Are you a CNA who's looking to level up your career? Our Qualified Medication Aide course gives you the training you need to start passing meds safely and confidently. If you're in Florida with 1 year of CNA experience, you can attend our Qualified Medication Aide course. It includes 26 hours of online training, followed by 14 hours of in person, hands on training with Nurse Eunice. Take the next step in your career. Enroll today at www.fltraining.com.
Hey team, good afternoon and welcome back. This is Nurse Eunice, and in today's video, I'm helping you pass the Medication Aide / the Med Tech examination. That is right. This video has been requested from multiple viewers, so we thank you for your patience. And as we do in each of our videos, we're going to give you about 10 seconds to receive your notification. So we're going to get started shortly. Today, I will not be monitoring the chat. I do apologize. We have 70 questions to get through, and I want to get through them in a timely manner. So let's go ahead. Let's get ready to get started. If you're unaware, I do have my own online CNA course that is good globally. No, it's not going to certify you. It's going to prepare you for your certification. So if you're having a hard time understanding, if you need flow sheets, if you need a question bank, scan the QR code, open up your camera app on your phone, scan the code, and there's going to be a link that pops up. Click that link. It's going to take you directly to Nurse Eunice's online CNA course, or you can go to fltraining.com, which is also on the screen. And when you go there, the 3 lines up top would be the menu. You can click on online courses, and you can also access the online CNA course directly from our website. There's no commitment. So if you can finish your materials in, 3 to 4 weeks, that means that you only paid $29.99. But you all, it is awesome. And our students are passing. So thank you for trusting Nurse Eunice. Some of you asked for more resources, and I apologize. I have about 5 different med tech medication aid videos. I finally compiled them into a playlist. So use your phone, open up your camera app, point it towards this QR code. A link will pop up that will take you to the playlist on YouTube. So if only thing you need are videos to help you pass the med tech or the medication aid. We use those terms interchangeably. If that's all you need, you don't want CNA, you don't want CPR, use the QR code. It's going to help simplify your life. All right, so let's get ready to take our practice test, everybody. I want you to find a quiet space so you can focus. Go ahead and have some scratch paper handy, also a pencil or a pen. We're going to read each question, and then I want you to trust your instincts. You already have the heart for patient care. In some states, I'm going to talk about Florida because that's where I'm based. In the state of Florida, a CNA with 1 year of experience can become a qualified medication aide. That's a QMA. Prior to that, anyone who's unlicensed can take a course to give medications to be a med tech or a medication aide. I don't think that's the safest route. I would prefer for you to have some knowledge of healthcare, blood pressures, etc. But I want you to really consider, look at your state's protocols, your state's rules. This is somebody who is not a nurse. They're not an LPN. They're not an RN, but they are able to give medications with limitations. So you won't be able to do everything, but that would be a way for you to be in the medical field without necessarily working the role of a certified nursing assistant or a patient care tech. Remember, I'm in Florida. You have to know your state's rules, so do some research on your end, but look up medication aid, medication tech, or you can also look up qualified medication provider. All right, let's get going, team. Question 1. What is an important consideration when dealing with medication interactions? A, discuss your concerns with the licensed nurse. B, discuss your concerns with the pharmacy tech. C, discuss your concerns with the physician. Or D, discuss your concerns with the patient's family member. We have 70 questions that we're going to review today, so I won't be monitoring the chat, but I do love you all. Hello, hello, hello. If you feel that I'm revealing the answers too fast, you can always rewatch the video. You can slow it down. You can pause it, Or if you use these settings, you can change the playback speed. So everybody, the correct answer for question 1 is, of course, A. That's right. Medication aid should not assess or manage interactions. What you're going to do is, if you think the patient's having a medication interaction, you're going to involve that nurse. The nurse has to come in and assess that patient, and she will decide if a doctor needs to be called or notified. Sometimes your patients, they may already have some type of anti-inflammatory or antihistamine ordered, but you have to get your nurse in the room for further assessment. Question 2, a resident's blood pressure medication was scheduled at 8 a.m. It is now 8:59 a.m. What is the most appropriate action? A, administer the medication and document it as if it was given on time. B, do not give the medication and continue your med pass. C, ask the nurse to give the medication instead. D, review the facility's late medication policy and follow the physician's order. This one's tricky. Revealing the response in 3, 2, and 1. You all, it would be D. Some facilities do give an hour window, but that's for certain medications. That's not for every medication. So med techs must follow their facility's protocol for administering medications outside the scheduled time frame. Again, most facilities will allow a grace period, which is typically 1 hour before or after the scheduled time, but you have to make sure this is verified, make sure that's accurate, because giving a medication late without proper documentation or skipping it entirely may result in a medication error. The nurse should be notified if the med is beyond the allowed time frame or if clarification is needed. Question 3. A med tech is preparing to administer a transdermal patch. What must be done before applying a new patch? Is it A, apply the new patch directly over the old one? B, shave the application site? C, remove the old patch and clean the skin? Or D, cut the patch to fit the location? All right, I see some correct responses coming through. Revealing the answer in 3, 2, and what you must do before you apply a new patch would be C. After you remove the old patch, you're going to clean the area to avoid overdose and irritation. And then we rarely put a patch on the same exact location unless it's specifically ordered by the doctor. For example, sometimes the nitroglycerin ointment, if a person has poor circulation to their left leg, the doctor's going to write an order where we put the patch, the medication on that left leg to improve circulation. But outside of that, even with the leg, you're not going to continue to put it on the same exact spot. You can put it on the outer aspect, the inner aspect, but yeah, you do want to be moving the location of your transdermal patches. Question 4, which route of medication administration involves delivering medication directly into the stomach through a feeding tube? Would that be A, oral, B, enteral, C, intravenous, or D, rectal? So your patient has a feeding tube. How would that medication be delivered? And you're so smart. You're absolutely right. It is B. So enteral refers to administering medications via the gastrointestinal tract using a feeding tube such as a G tube, and that would be a gastric tube. And in some of your facilities, you may have to assist, but that means that the nurse has trained you on how to do so. Do not do something if you're uncomfortable or if you've never provided G tube care before. Question 5, when can a med tech give a PRN or an as needed medication? Is it A, if the client requested? B, and this is MAP, so that'll be medication associate provider or assistant provider, when the MAP thinks the client needs it. C, only if there's a specific order, including reason and frequency. Or D, if a coworker agrees. I'm sorry to keep using all these interchangeable terms, but again, the term will change based upon your location and your state. So when can you as a med tech give a PRN medication? Yeah, there has to be an indication. So the answer is C. So PRN meds must have a valid order that includes the dosage, the frequency, and the reason for use. For example, Tylenol could be given for a fever. It could also be given for a headache. So if a patient only has it prescribed to them for a headache, and now they have an elevated temperature, and you decide to give the Tylenol, that's a medication error. You did not give it for the appropriate reason prescribed by the doctor. And so that nurse would have to notify the doctor of that elevated temperature because maybe we need cultures. So you just don't want to give a PRN medication because it's there without looking for the reason that it was initially prescribed. Question 6. What should a med tech do if a confused client refuses to take a medication? A, try again later without documenting it. B, skip it and mark it as given. C, hide the medication in food. Or D, document the refusal and notify per facility policy. Right? Your confused client, they're refusing their medication. So of course you're going to do D. We're always going to document. That saves the patient and it also saves us. So we're going to document. Med techs must follow documentation protocols and notify supervisors, which would be your nurses, when refusals occur. And what I usually do is I notify the nurse first, and then in my documentation include that the patient refused and that the nurse was notified. Otherwise, it's going to look as if you just, didn't give the patient a medication and you did not alert your supervisors. Question 6. What is required before altering the form of a medication, such as crushing a pill? Is it A, verbal approval from another med tech, B, a written order from a healthcare provider, C, client consent, or D, the med tech's discretion? Right. So before you crush a pill, before you alter a medication, you have to have B. There has to be a written order for you to do so. So crushing or altering medication requires a healthcare provider's written order. What do we mean by a healthcare provider? It's someone who can write prescriptions. That would be your doctors, your advanced registered nurse practitioners, or I think they call them APRNs now. It could be a physician's assistant, but it's rarely going to be your nurse or your charge nurse. So it has to be one of those advanced providers. And so when the advanced provider writes the order that allows you to crush a medication, that is when it could be crushed, because not all tablets can be crushed. Some are extended or enteric coated and can be harmful if altered. In addition, if you're finding yourself needing to crush that many of your patients' medications, maybe they don't need to be taking pills. Maybe some of those medications could be converted to a liquid form. So you notifying the nurse who then notifies the provider is so important so that we can make sure this patient's swallowing abilities get assessed. And then on top of that, that we can change the form in which their medications are given. And that makes your life easier also. Question 7, you notice that a medication label doesn't match the MAR. That's your medication administration record. What should you do? A, give the medication and update the MAR later. B, document the label instead. C, hold the medication and review the physician's order. Or D, cross out the label and rewrite. So the medication label doesn't match the medication administration record. All right. And so if you chose C, you are a safe caregiver, and I love it. So med techs must not give medications with discrepancies. If something's not right, you have to alert somebody. And so from there, we're going to follow the facility policies to make sure that we avoid medication errors. 8. If a patient's medication appears different than usual, what should you do? And I've had this happen before. Is it A, assume the pharmacy, change manufacturers, and proceed? B, ask the resident if it looks familiar and then give it? C, stop and verify with the nurse or pharmacy before administering? D, give the medication anyway to avoid delaying care. And those patients know how many pills they receive. They know the colors and the shapes. And so if you bring a pill in stating that it's one thing, but the appearance looks different, your patient, your resident, they're going to be questioning you. but you should have been the first one questioning. So it's going to be C. You got to stop. You got to make sure this is the right pill. Sometimes your facilities do change manufacturers, but maybe the pharmacist made a mistake. So any change in appearance should be confirmed to avoid administering the wrong medication. Great job. I'm happy you got that correct. Question 9. A medication aide may administer which of the following? A, oral medications that have been pre-approved by the nurse. B, IV medications if no nurse is available. C, chemotherapy agents. Or D, narcotic injections. Revealing the correct response in 5, 4, 3, 2, and 1. It is A. Medication aides can administer certain oral medications, but must follow state and facility guidelines. Let's say a patient has cancer and they have their chemotherapy, their medications are now oral. So that's not going to be something that the nurse is going to allow a med tech to administer. The nurse would have to administer that anti-cancer agent, but you can administer the other medications. So not all oral medications can be administered by a med tech or a medication aide. Question 10, which of the following is an example of a common medication error? Is it A, administering a medication with water, B, administering medication without confirming the identity of the resident, C, checking the MAR before giving a medication, or D, washing hands before the medication pass? Which is a common medication error? Yes, it is B. You have to verify the identity of your patient. So giving medications to the wrong patient or wrong resident, it is a serious and preventable error. Always verify the resident's identity before giving medications. Question 11. Before giving digoxin, a heart medication, what must a medication aide do? Is it A, ask the resident how they feel, B, check the blood sugar levels, C, take the apical pulse and report it to the nurse if required, D, administer it with orange juice? And this may be a new term for a lot of you all, especially if you're not in nursing school. So I want you to make this note for digoxin. You're going to do C. You have to learn how to take an apical pulse. So before giving digoxin, the apical pulse must be checked for 1 full minute with a stethoscope. The apical pulse is taken over the heart. It's usually the 5th intercostal space, like mid-clavicular, and is required. Apical pulse is taken over the heart and is the required method because it's more accurate for detecting irregular rhythms. When a patient is taking digoxin, it's usually because they have atrial fibrillation. So their heart rhythm is irregular, which means that when you're taking a pulse, a radial pulse is also going to be irregular. There may be some heartbeats that have been skipped. And so the best way to obtain an accurate heart rate is to put your ears to their chest. You're going to use your stethoscope at the apex of the heart, and that's where you will determine the apical pulse. And so let's talk about the radial pulse, which is where you normally feel for a pulse. So the radial pulse is located at the wrist. However, when someone has an irregular heart rhythm, aka a patient who's prescribed digoxin, it is not the acceptable location for checking the heart rate. And this is an extra note that I want you to write, because if the apical pulse is below 60 beats per minute, you should not be given digoxin. Digoxin slows down the heart rate. And so if you give it and the heart rate's already below 60, that means that it's below normal. You're giving a medication that's going to slow it down even more. That means your patient can become dizzy. They can start having low blood pressure. So digoxin, apical pulse, hold if the heart rate's less than 60, and of course, notify your nurse if you have any concerns. So when you all tell me that, oh, all I'm doing is passing heart medications and all I'm doing is passing diabetic medications, and you see me cringe, I'm cringing because those medications have side effects. So if you're going to be a med tech or a medication aide, make sure you're a good one. All right, let's go to our next one, team. Question 12. Before administering medication, which 3 items should a med tech compare to ensure accuracy and safety? Would it be A, the client's name, room number, and diagnosis? B, the medication time, dose cup, and storage location? C, the medication label, the MAR, and the prescriber's order? Or D, the client's mood, appetite, and preferred drink? And while you read through that, I'm going to take a sip of water, so I'll give you 10 seconds on this one. I see some mixed answers coming through, but it is C. That's right. So a proper 3-way check means that you have 3 items in front of you. You have your medication that has the label. You have your medication administration record, which is also referred to as the MAR. And then you have the physician's order. So the physician wrote the order. The pharmacy dispensed the medication. You compare the physician's order to the label that is on the actual pill container. And then you compare that to what is either written or typed on that MAR. And that would be your 3-way check. And when you get through with that, you still have to go to the patient's bedside and then do your patient identifiers, ask for their name and their date of birth. So there are so many ways to prevent a medication error. If a medication error does happen, it's usually because you missed one of those steps. Question 13, which of the following is the legal responsibility of a medication aide? Is it A, diagnosing side effects, B, making drug substitutions, C, prescribing PRN medications, or D, documenting medications administered? What is a legal responsibility? Reveal the answer in 3, 2, and yes, it is D. Okay, so medication aides must accurately document all medications given. You do not diagnose, you don't prescribe. All of that would be outside of your scope of practice. 14, if a resident is asleep when you arrive to their room to give medication, what should you do? A, wake them gently and proceed as ordered. B, skip the dose without telling anyone. C, leave the medication at the bedside. Or D, give double the dose later. Yeah, this one isn't as tricky, but I can see you're torn between 2 different responses. And so the answer to 14 is going to be A. We have to wake them, you all. You have a time frame. You have to give your medications. And so medications must be administered as scheduled unless refused or held by the nurse. And so it would not be C. You would not leave medications at the bedside. The patient can wake up, knock them over, the roommate could take them, or someone's child, a visitor could come into the facility, or a confused person into that room and they could take the medication. So you should not leave any medications at the bedside. 15, what is the best way to ensure the right patient when giving medication? Is it A, ask another resident to verify the name? B, check the MAR and room number only. C, use 2 identifiers such as name and date of birth. Or D, recognize them by sight alone. And I already gave you this answer by mistake, so we're going to go ahead and continue. So the answer to question 15 is, of course, C. So always use 2 identifiers to avoid giving medication to the wrong patient. If your patient is confused, you don't walk into their room and say, hey, Mary Sue, I'm Eunice. I'm your med tech today. I'm here to give you your medication, because she's going to pretend as if she's Mary Sue. She didn't even hear what you said, probably. So whenever you knock and you enter the room, you're going to introduce yourself, and then you're going to ask, while you're looking at their armband, you're going to ask for their name. And if they are confused and unable to give you their name, you're going to have to use, sometimes your facilities will have a chart with a photo attached to their personal file, or you can get the nurse to verify that patient's identity. If you're in a hospital, every patient would have on an armband, but in some of your long-term care facilities, they do not have on armbands. So you will have to ask the person their name and their date of birth. If they're unable to tell you, that's when you would follow your facility's protocols, which might include asking your nurse. 16, after giving the medication, what is the next step? A, document it on the MAR. B, clean up the med cart. C, give a snack. D, return to the storage room. That is right, because if you don't document it, you have no proof that you did it. It is A. Medications must be documented immediately after they are administered. Question 17. If a resident begins coughing after swallowing medication, what is the first action? A, leave to call a supervisor. B, attempt the Heimlich maneuver. C, encourage the resident to cough. D, offer water immediately. So a resident begins coughing after swallowing their medication. Yes, that's a sign of aspiration, but it isn't necessarily a sign of choking, so you won't have to do the Heimlich maneuver. If the patient can cough, you're going to do C. You're going to encourage them to cough because coughing is the body's natural way to clear the airway. Do not leave the resident or offer them water until you are sure that their airway is cleared. Again, use of the Heimlich maneuver is only used if the resident shows signs of choking, not coughing. Coughing and choking, even though we use them interchangeably, coughing indicates they still have air exchange. Choking, there would be no air exchange. There would be no coughing. There would be a look of gloom. The patient will not be able to speak or cough, and that is when you would perform the Heimlich maneuver. 18. Which of the following should always be verified before administering medication? A, the doctor's phone number. B, the resident's dietary preferences. C, the date the medication was opened. Or D, the medication expiration date. Revealing the answer in 3, 2, and... All right, and so you all, it's not C, it should be D, so that is incorrect. It is D. It's even though it's nice to know the date that the medication was opened, the date that the medication expires is more important than the date that it was opened. So the answer again is not C, it would be D as in dog, because giving an expired medication can be dangerous. It might not be effective. So you always want to check the expiration date before you give the medication. Question 19, which document is used by MedTechs to legally record the date, time, dosage, and route of each medication given to a resident? Would it be A, a physician's order sheet, B, a medication administration record or a MAR, C, an incident report form, or D, daily shift communication log? And I don't expect any of you to answer this one correct because you are so smart. And that's right. You know that it would be B, MAR. So the MAR is a legal document used to track and document all medications administered, including the time, dose, route, and any omissions or refusals. Excuse me. Question 20. Which of the following lists all of the recognized rights of medication administration? And this is a long one. So would it be A, right resident, right doctor, right appointment, and right insurance? Would it be B, right time, right lab result, right diagnosis, and right billing? C says right medication, right dose, right resident, right time, right route, right documentation, right reason, right response, right education, and right to refuse. And D states right location, right shift, right nurse, and right routine. Which of the following list all of the recognized rights of medication administration? And that's right, it is C. I'm not even going to go to the next screen. I need for you to write these rights down. You have to know these. All right, and so it is C, you all. And let's talk about, we understand the right medication, the right dose, the right resident or patient, the right time, the right route, the right documentation. Remember, we talked about Tylenol being for a headache and or for a fever. You have to make sure that you're given that medication for the right reason, the prescribed reason. And let's say we're giving it for a headache. An hour after your patient's headache has worsened, it went from a a 5 on a scale of 0 to 10, and now it's a 9. That Tylenol did not have the right response. That would be a reason that the provider would need to be notified. You have to notify the nurse so she can call that doctor, because there's no reason that the headache should be getting worse after being administered Tylenol. The right education. Maybe this is a new medication. As a med tech, as a medication aide, you would not be providing the medication. That would be the nurse's duty. All right. And then the right to refuse. Yes, they don't have to take their medications. They can refuse. So following all ensures safe and legal medication delivery. And so if you learned something new, give us a thumbs up. If you haven't already done so, don't forget to subscribe to our channel. Question 21, and we're going all the way to 70, team. A med tech is preparing to administer eye drops. What action ensures proper technique? A, touch the dropper tip to the eye. B, apply drops to the lower conjunctival sac. C, place drops directly on the cornea. D, insert drops with the client's eyes closed. Now, D makes no sense. So we're not putting eye drops on the exterior of their eyes. So everybody, the answer would be B. It has to go into the conjunctival sac. So drops must be placed in the lower conjunctival sac to avoid injury and ensure proper absorption. You're not going to put it directly on the eye itself. 22. Before giving a medication, a med tech checks the label, the mark, and the order. What is this called? I just mentioned it. You got to get this right. I have faith in you. Is it A, double verification method, B, the two-way check, C, a safety check, or D, the three-way check? Let's see how good your retention is. Did you retain this information that I just covered? And if you chose D, the three-way check, you have it. Ding, ding, ding. So the three-way check compares the label, the mark, and the order to ensure the right medication is given to the right person. 23, which of the following is outside the scope of practice for a medication aide? Remember, when I say medication aide, it could be med tech, it could be a qualified medication provider or associate. All these terms are used interchangeably depending on your state and your facility that you work in. So with that being said, which one is outside the scope? Would it be A, giving a resident their oral medications, B, documenting medication refusals, C, injecting insulin, or D, observing for side effects? Yep, and it is C. You all cannot give injections. So giving injections is not within a medications aide's role in most states. Always follow your state's regulations. If you decide to practice outside of your scope of knowledge and that patient is injured, not only could you be charged with, abuse and neglect, but you could be charged with, maybe you're telling people you're a nurse. So just be very careful. You are not a nurse. You are a med tech. You're a medication aide. I need for you to know the rules regarding the profession that you choose. 24, what should you do with a medication that requires refrigeration? A, place it in the designated medication refrigerator. B, keep it in a resident's personal refrigerator. C, store it in the nurse's office. Or D, leave it on the medication cart. Great job. It is A. We can't put it in the patient's refrigerator, but they're going to try. They're going to ask, why can't I just keep this in my room? No, for safety, we have to store this. So medications requiring refrigeration must be stored in a temperature-controlled medication refrigerator that is located in a secure location. So you'll usually have a med room. And so within your med room will be where the refrigerator for medications would be located. 25, what does it mean if a medication is enteric coated? Say that word with me, enteric coated. Does it mean A, it can be chewed for faster effect, B, it can be crushed and mixed with applesauce. C, it must be dissolved in water. Or D, it is coated to protect the stomach and should not be crushed. And some of your aspirins have an enteric coating. So whenever you see something that has a coating, that means that more than likely that medication irritates the stomach lining. So it's going to be D. Enteric coated pills are designed to dissolve in the intestine, not the stomach. Crushing them defeats their purpose and can be harmful. 26. Which of the following best describes a medication aide's responsibility? Is it A, make decisions about adjusting medication dosages? B, monitor and report changes in the resident's condition? C, assess the effectiveness of medication? Or D, change medication orders when needed? All right, giving you a few seconds to answer this one. Yeah, you have it. It is B. Medication aides observe and report, and they do not make clinical assessments or alter treatments. Question 27. A resident is scheduled to receive medication at 8 a.m. When is it considered on time? Would it be A, exactly at 8:30 a.m. only? B, within 1 hour before or after? C, within 2 hours before or after? Or D, anytime during the shift? Yeah, you remember from question number 1 or number 2, it would be B, because most facilities allow a 1 hour window before or after the scheduled time. So if your patient's medication was due at 8 a.m., usually at 7 a.m., you're too busy, but you have that hour window before and that hour window after. So an 8 a.m. med could legally be given between 7 a.m. and 9 a.m. unless otherwise stated by your facility. 28. Which of the following demonstrates the right documentation? A, recording meds before giving them. B, using whiteout to fix a mistake. C, initialing the MAR immediately after giving the med. Or D, leaving the MAR blank for the next shift. You have it. Great job. It is C. So MAR should be completed right after administering medication. Errors, we don't use whiteout. If you make a mistake, you use one single line to cross out. We always need to see the original entry, and then you'll put your initial at the end of that line. And so if you do make an error on your MAR, no whiteout, no scribbles, one line with an initial. And that way we know who made that change in the medical record. 29, a resident is on a fluid restriction. What should you consider when administering oral medication? A, give medications with large amounts of water. B, mix the medication in applesauce. C, mix the medication into drinks to help them swallow more fluids. Or D, use the minimum amount of water required. All right, giving you a few more seconds with this one because this one's a little more tricky. You have a resident on a fluid restriction who needs to take their oral medications. You're going to do D. That's right. You're going to use the least amount of water needed to safely swallow the medication and stay within the fluid limits. You cannot do B. You cannot do C. If you mix it in the applesauce, first of all, I don't have a swallowing issue. I have an issue with retaining fluids. So I don't want you crushing up my pills and putting them in applesauce. That's not something that you would do anyway without a doctor's order and also notifying that patient. So it would not be B. It also would not be C, because if you mix the pills, the crushed pills, in, let's say, my orange juice or another beverage, what if I don't drink that beverage? If I don't drink it all, they still did not receive their full dose of their medication. And so you can give medications while also adhering to the fluid restriction. 30, a resident's blood pressure is too low before a scheduled antihypertensive dose. What should you do? A, wait 10 minutes and recheck. B, give the medication anyway to maintain the schedule. C, hold the medication and report to the nurse. Or D, ask the resident if they still want it. So they have a scheduled antihypertensive medication. You check their blood pressure and the blood pressure is too low. What should you do? Yes, it's going to be C. You're going to have to hold that medication, notify your nurse, because antihypertensives can lower the blood pressure even further. And so that nurse needs to come in and assess and possibly even call the doctor. We want to make sure that we don't lower that blood pressure any further. Question 31. A resident begins scratching and develops hives shortly after receiving a new antibiotic. What type of reaction may be occurring? Would it be A, a therapeutic effect, B, adverse reaction, C, desired side effect, or D, drug tolerance? All right, we see some great answers coming through. Yes, it would be B. That would be an adverse effect or an adverse reaction. So hives and itching suggest an adverse reaction, which may be an allergic response that requires immediate attention. Question 32. A resident spits out a medication after attempting to swallow. What should you do? Would it be A, force them to swallow it again? B, ignore it if most of the pill is taken? C, try giving it again right away? Or D, report to the nurse and document the incident? And I know that the answer for a lot of these were follow your facility's protocols, notify the nurse. Well, that's because there's only so much you all can do as a med tech. So if that patient spit out their pill after attempting to swallow it, more than likely you're going to need a new pill. You got to document there's a discrepancy. It's going to be D. Any refusal, spitting out, or incomplete dose must be reported and documented. It's not that we're trying to undermine you. It's that whatever you're doing falls under that nurse's license. And so let's say it was a narcotic. It was a pain medication that the patient spit out. You and the nurse would have to witness. She'd have to waste that medication. 2 people would sign off on it before another medication could be given. Otherwise, it may be looked upon as you trying to steal a medication. So follow the protocols. Question 33. Which drug class is designed to relieve pain? Is it A, antibiotics, B, analgesics, C, antacids, or D, diuretics? That's right. As a med tech, you have to learn your drug classifications. So antibiotic, analgesics, antacids, or diuretics. If something is relieving pain, it is going to be B. It is an analgesic. So analgesics relieve pain and can be over the counter, such as Motrin, or it could be a prescribed medication also. Question 34. Which type of medication is used to reduce inflammation? Would it be A, a corticosteroid, B, an inflammatory agent, C, an antipyretic, or D, antihistamine? Give you a few seconds to read over that one. I know that one may be a little bit trickier than normal, but you have your paper, you have their pen there, and you came here to learn. And by golly, that is what we're going to do. So a medication that reduces inflammation would be A. Yes, it's a corticosteroid, or we just call them steroids for short. Reduce inflammation are commonly used in conditions such as arthritis or asthma. Let's go back and look at the others. Inflammatory agent. You're not going to give a medication that causes inflammation. So that's just something I made up. An antipyretic, C, that could be something that would lower the temperature. And then D, an antihistamine, that would be used not necessarily for inflammation, but for hives, itching, an allergic reaction. So that would be an antihistamine. All right, 35. Which of the following medications is classified as an anticoagulant? Would it be A, digoxin? Would it be B, albuterol, C, metformin, or D, warfarin? All right, so which of the following medications is classified as an anticoagulant? I need for you to understand your prefixes, your key terms. Anti is against, and then coagulant is something that clots. So which of these would be a medication that prevents blood clots? And if you chose D, warfarin, great job. So warfarin is an anticoagulant that prevent blood clots, and med techs must observe for signs of bleeding because it thins the blood. How would you know if your patient's bleeding? Well, when they brush their teeth, are their gums bleeding? So things like that you want to be asking your patient about. What's the color of their stool? If they say their stool is black or tarry, that could be an indication of, number one, maybe they're on an iron supplement, but it could be something worse. It could be that they're bleeding internally. So you want to be monitoring. That's why we have you document the color of their stool and the consistency, etc., because we are the eyes and the ears of the doctor. And so if you haven't done so already, you see that subscribe button and that bell. Some of you are like, Nurse Eunice, when do you come on? My schedule is all over the place, but I do try to come on here at least twice per week. But you'll know when I come on if you subscribe and turn your notifications on. Question 36. Which condition would most likely be treated with bronchodilators? Is it A, diabetes, B, hypertension, C, asthma, or D, seizures? Why would a resident need a bronchodilators? Bronch, what is that referring to? Dilator, what is that referring to? All right, so if it's not constricting, it's dilating, it's opening up. When you think of bronch, think of bronchioles, the branches at the very base of the lungs. So we need someone's airway to open. What are we going to give? It's going to be a bronchodilator. Who needs their airway open? It would be somebody with asthma. It is C. Great job. So bronchodilators open the airways and are commonly prescribed for asthma and other respiratory conditions. So you have to understand prefixes, key terms, and suffixes for you to be in the healthcare field. And we have videos on that. We have a library of medical terminology practice tests to help you learn these terms. Question 37. Which medication route is used for applying creams and ointments? Would that be A, oral, B, topical, C, transdermal, or D, rectal? So when we tell you about the right route, these are some of the routes. But which route is used for applying creams and ointments? Yes, yes, yes. It's not C. It's not C. It is B. Topical medications are applied directly to the skin for local effects. So if someone got bit by an ant and they had redness on their hand, inflammation, you may have to put on a corticosteroid. We're going to put a topical cream on their skin. Yes, you have to wear gloves. If you don't wear gloves, well, now you and the patient are being treated for this ant bite, but only the patient got bit. So always wear gloves when you are giving or applying topical medications. Question 38. A resident needs eye drops and ear drops. Which should be given first? Why does it even matter? A, are you going to give the eardrops first? B, the eye drops first? C, it doesn't matter? Or D, ask the resident their preference? Miss Eunice, what would you like first, your eye drops or your eardrops? I know we teach you all about this compassion and getting, including the patient in their care, but this one, honestly, is going to be B. You all do the eye drops first, because whenever you're instilling eardrops, the head may need to remain tilted for several minutes. And so if you put the eardrops in and then tilt the head, what happens to the medication you put in their eyes? It might run out also. So you administer your eye drops first to avoid, any medication from coming out of the eyes, because you're putting in their conjunctival sac. But then on top of that, it avoids you having to change the position. So do the eye drops, then tilt their head, do the eardrops, remain with them for the 2 to 3 minutes, whatever the medication requires, to make sure that that medication gets into the ear canal. 39. When a resident takes sublingual nitroglycerin, you should do which of the following? Is it A, have them chew and swallow it slowly? B, place it against the inside of their cheek? C, place it under the tongue? Or D, give it with water? Sublingual. You're given a sublingual medication. So sublingual is a route. And so with sublingual medications, you do C, it goes under the tongue. So sublingual medications such as nitroglycerin and also B12 must be dissolved under the tongue to be effective. Question 40. What does it mean when a medication order says give with meals? Is it A, give 1 hour after meals? B, give at bedtime, give before bedtime. C, mix the medication into the meal. Or D, administer while the resident is eating or shortly after. What are we meaning when we say give that medication with a meal? And then I always like for you to ask why. You may not be asking your nurse why. You're going to refer to your drug reference materials, the intranet in your facility, because if you're given something with meals, that must means that it irritates the stomach. So it's going to be D. With meals means during or immediately after eating to improve absorption or to reduce stomach irritation. So read those labels carefully. Question 41, and remember we're going all the way to 70, so thank you for being here so far. What must you always check before administering an anti-diabetic agent? Would it be A, the blood sugar level, B, the blood glucose level, C, the pulse, or D, the blood pressure? And for this one, oh, that vehicle's loud. For this one, I will accept 2 answers. So, what do you always check before administering an anti-diabetic agent? So today we've learned about antihypertensives, we've learned about anticoagulants, and now we're talking about anti-diabetic agents. And so if your patient has diabetes, before you give something that's going to fight their diabetes, aka regulate their blood sugars, you need to know either A or B. We have to know the blood sugar level, or another term for that would be their blood glucose level. So whether you chose A or B, you are correct. So anti-diabetic agents lower the blood sugar. So it's essential to check the blood glucose level before administration to avoid hypoglycemia. Hypo means lower than normal. Glycemia refers to the glucose within the bloodstream. So hypoglycemia, or in other words, a dangerously low blood sugar level. 42. Which of the following medications helps break up mucus in the lungs? Is it A, expectorant, B, antacid, C, antihypertensive, or D, diuretic? That's right. You're going to learn these medications. You're going to be knowledgeable when you're standing in front of your residents and your patients and you're passing medications. Again, even though you may not perform the initial education, you are responsible for knowing the side effects, what these medications do. And so a medication that breaks up mucus in the lungs would be an expectorant. It is A. So an expectorant loosens the mucus, and once it's loosened, it's going to help that patient cough it up. And so a natural expectorant is give your resident fluids. Give them some water. That's going to thin out the mucus. And so if you're just giving them expectorants, but you're not asking them to increase their fluid intake, it's still going to be, sometimes they have that non-productive cough where you can hear the rattle, but nothing's coming up. Well, we're going to give them expectorant, but we're also going to encourage them to drink more fluids. We don't have to overdo it, but hey, let's try to drink at least, a cup or 2 of fluid every 8 hours, at least once per shift, especially if the patient doesn't have a fluid restriction. 43. A resident's MAR says furosemide 20 milligrams PO daily at 9 a.m. You notice they haven't had any output since yesterday. What should you do? Ooh, this one's loaded. Number one, you have to know abbreviations. Number two, you have to know medications. And then three, you have to know interventions. You want to be a med tech? I'm helping you get there. So the MAR says furosemide, 20 milligrams PO, that means by mouth, daily at 9 a.m. What is the purpose of furosemide? You notice they don't have any output. They've not had any output since yesterday, but they're not telling you what type of output. Would that be urine? Would it be blood? Would it be mucus? Would it be fecal matter? Did they not have a bowel movement? So you have to know your medications. Is it A, do you give the medication? B, hold the dose and wait? C, push fluids to help? Or D, report it to the nurse before giving it? So your resident, furosemide, 20 milligrams, PO, daily at 9 a.m. They've not had any output. Yes, if you notice something wrong or something strange, you have to report it to your nurse. So furosemide is a diuretic. It removes excess fluids from the body by causing your patient to urinate more frequently. So furosemide is a diuretic. Lack of urine output may signal an issue. Is there an obstruction? What's going on? Why isn't this patient urinating when I'm giving them a medication that is designed to make them urinate? So the nurse should assess that patient before you administer your next dose. Otherwise, the patient could end up retaining urine. They may need a catheter. So it's just a lot that goes into that. Get your nurse into the room. When in doubt, call your nurse. 44. Which of the following is a route of medication administration that a medication aide is typically not authorized to use? Is it buccal, topical, rectal suppository, or sublingual? Ooh, I see you're torn. Is it A or is it C or is it D? I see the rainbow on this one. I see all the letters of the alphabet, but you all, what you can't do is anything invasive. So you cannot do C, rectal suppositories. So medication aides are generally prohibited from inserting rectal suppositories, as this is considered an invasive procedure. It must be performed by a nurse or licensed provider. And so I know some of you are like, well, I'm a CNA and I have a license. According to the National Board of Nursing, nursing assistants, PCTs, they are classified as unlicensed assistive personnel. So I know you have a license, but in the Board of Nursing eyes, you are not a licensed practical nurse. You're not a registered nurse. So in their eyes, you are unlicensed. I know that may be confusing, but if you're unlicensed, if you're a CNA, a PCT, or a medication aide, you cannot do anything invasive. Question 45. Before giving a resident a potassium supplement, you should do which of the following? A, check if they've eaten. B, check if they're on a stool softener. C, check if they're allergic. Or D, give with water. Yeah, I will accept two answers for this one. But if someone's allergic to potassium, they're going to die. Like literally, they're going to die because your body needs potassium. Your heart needs potassium. Your muscle needs potassium. So everybody, the answer is not C. I've not had one patient with a potassium allergy. You literally cannot live without potassium. So you all, before you give a resident potassium, you should do A. You have to check to see if they've eaten, because potassium supplements, especially in tablet or capsule form, can cause stomach irritation, nausea, and even ulcers if taken on an empty stomach. Giving potassium with food helps to minimize gastrointestinal side effects and improves tolerance. Plus, these are big old, your patients are going to call them the horse pills. They are huge pills. So whenever you're thinking of potassium, it's usually given with breakfast. If they're taking them twice per day, we're going to give them with breakfast. Or if it's past dinner, make sure that patient receives a bedtime snack, whether they're a diabetic or not, because you don't want them taking potassium on an empty stomach. 45. Which of the following oral routes delivers medications by dissolving it between the gum and cheek? Is it A, sublingual, B, buccal, C, enteric coated, or D, parenteral? And you all make me so proud. I get so many messages. I may not respond to all the messages, but when I see those messages from you from all around the globe, all around the world, telling me that you passed your examinations because I spent 30 minutes to an hour coming on and just doing review questions with you, you all, that gives me purpose. And so if I haven't told you how much I appreciate you for learning, for watching, for wanting to be the best healthcare providers possible, let me let you know right now, I appreciate you. So question 45, the answer is B, buccal. So buccal administration refers to placing the medication between the cheek and the gum, allowing it to absorb into the bloodstream without being swallowed. We may do that for our patients who are on hospice. So we know right now it's not safe for them to swallow anything. Maybe they're becoming less responsive, so we can give their medications via the buccal route. 46. Which of the following routes delivers medications into the muscle? Is it A, PO, B, IV, C, SC, or D, IM? And if you don't know your medical abbreviations, of course we have a video for that on our YouTube channel. So you have to know your abbreviations. You have to know these acronyms. And so let's go through them together. Put it in chat. What does PO stand for? What does IV stand for? What does SC mean? And what does the abbreviation IM refer to? All right, give you about 10 more seconds and then I'll reveal the correct response. Yep, you have it. That is right. That's right. I see some great responses coming through. So A, PO is not the correct response. PO stands for oral. B, IV isn't the correct response because IV refers to intravenous. That means it's in the vein. CSC is not the correct response because SC stands for subcutaneous, as in it's in the fat layer. And so that would be something similar to like an insulin injection. And then DIM is the right answer. IM stands for intra. That means inside the muscle. So IM is intramuscular or intramuscle. And that is usually for those medications that have to be administered in the muscle because they're irritating. So you all, even though you can't perform it, you have to know your abbreviations, because if you're given a medication thinking, oh, IM stands for something else, and you decide to go ahead and give this injectable and you give it via the wrong route, you've caused a serious medication error. And there it goes again, is D, because medications given IM are injected directly into the muscle tissue. 47, you're assisting with inhaler for a resident. What should you do immediately after the resident inhales the dose? A, give water. B, ask the resident to exhale. C, have the resident hold their breath for 10 seconds. Or D, apply lotion to their lips. Right, so your patient with asthma, they have their inhaler. You have to know how to use it. You're going to help them with it. And so you're going to hand it to them and you're going to tell them to do which of the following. Okay. It's C, that's right. They have to hold their breath for as close to 10 seconds as possible because holding a breath allows the medication to settle in the lungs for maximum effectiveness. 48, which medication route avoids the digestive system and delivers medication directly into the bloodstream the fastest? Ooh, is it sublingual, rectal, oral, or intramuscular? And notice it says the fastest, so this may be something new for you. All right, revealing the answer in 3, 2, And believe it or not, it's not D, it's A. So that's why they're nitroglycerin, they're having chest pain. We have them put one or tabs beneath their tongue because sublingual medications absorb quickly into the bloodstream through tissues under the tongue, thus avoiding that digestive process, that 30 to 45 minute, etc. And so the other one that would, of course, bypass the stomach and provide fast distribution of medications would be IV or intravenous, but that wasn't one of the options there. So it would be sublingual, which is a route that a med tech can actually use to administer medications. All right, our next one, team, is 49. A resident's medication order says give eardrops to right ear. Which step is incorrect? Is it A, warm the drops by rolling in your hand? B, pull the ear back and down? C, insert cotton deep into the canal? Or D, have the resident tilt their head? And the question wants to know which of the following actions would be incorrect. All right, and it's going to be C. We don't want to put cotton deep into the canal. Everything else is something you would actually do. So yes, you'd have your patient, you would actually warm up the eardrops by rolling them in your hands. You will pull the ear back and down. And of course, you have to have your resident tilt their head. So if you're putting an eardrop in the right ear, you'd have them tilt their head towards the left. Here's our rationale. You cannot use cotton deep in the ear canal because cotton may be used loosely to prevent leakage, but it should never be inserted deep into the ear canal as this can cause ear injury. Question 50. Which of the following is considered a controlled substance? Is it A, acetaminophen, B, ibuprofen, C, morphine, or D, vitamin D? Yep, everyone answered this one correctly. It is C, morphine. Morphine is a narcotic pain reliever and classified as a controlled substance, requiring secure storage and special documentation. Usually you're going to have someone sign out the morphine with you. And so it's under double lock and key to make sure that we don't have any narcotics being lost or stolen. 51, when assisting with a metered dose inhaler, or for short, MDI, the medication aide should instruct the resident to A, inhale quickly before pressing the canister, B, press the inhaler and inhale at the same time, C, exhale fully after inhaling the medication, or D, use it before rinsing the mouth. So your patient has their asthma pump, or they have their Spiriva, your metered dose inhaler. The medication aide should instruct the resident to do which of the following? And that's right. The only one that makes sense is B. They have to press it and inhale at the same time. Otherwise, they're not going to get their medication into the lungs. So it's going to be B. Proper coordination ensures the medication reaches the lungs. Rinsing the mouth may follow, but it's never before. It's always after. And usually we have them rinse their mouth because some of those metered dose inhalers contain steroids. And steroids, if left on the face, if left on the tongue, can cause thrush. Remember, people who are on steroids, especially for prolonged periods, they usually have a weakened immune system. So keep all that in mind. And if that container, if that medication, if it says rinse after use, help your resident rinse their mouth after using it. 52. Which statement about medication administration routes is true? A, all patches should be placed over the heart. B, sublingual meds must be swallowed immediately. C, suppositories may be given by med aides in emergencies. Or D, eye medication should be placed in the lower eyelid pocket, which is true. Excuse me. Yeah, it is D. Yeah, so lower eyelid pocket, aka conjunctival sac. So this allows the medications to absorb properly without damaging the eye surface. 53. A nurse asks you to assist a resident with a vaginal suppository. What is the correct response? A, I'll chart it after I give it. B, that's outside my scope. Please assist instead. C, I've done it before and don't mind. D, only if the resident agrees. This one's tricky. But if you've watched this video, you know that a med tech or medication aide cannot do anything invasive. So that's outside of your scope of practice. It's going to be B. Medication aides are not permitted to insert. You can't insert, you can't inject, you can't do it. I don't care how much you want to do it. You cannot do it. So you cannot insert anything into the vaginal area or into the rectum. That is outside of your scope of practice. That is the nurse's duty. Question 54. A transdermal patch is removed and the skin appears red and irritated. What should you do first? A, apply cream to the irritated area. B, place a new patch on the same spot. C, clean the site with soap and water. Or D, report it to the nurse. And I'll give you about 5 seconds to answer this one. I know which one you want to do, but that may not be the right answer. So if you want to do C, wrong answer, it's going to be D. So you all, if something's irritated, you don't put soap on it. If something's irritated, you don't put soap on it. If something's irritated, you notify your nurse. And so skin irritation must be assessed by the nurse. The patch should not be reapplied in the same spot until cleared. Do not apply soap to an irritated area without asking your nurse first. And now as the nurse, when you're telling me, I'm probably going to tell you to hold off on giving that patch until I can call the doctor. So I'm going to go in, I'm going to assess that patient's skin. I'm going to ask, hey, have you had this type of flare up before? Is this a new medication? I need to do my research because maybe the patient is allergic to the medication. So you just going and putting on a new patch in a different area and not telling the nurse would mean that now this patient's rash could be spreading. So I'm going to come in, I'm going to assess. If I do clean, I'm going to be cleaning with just warm water only, pat, 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 pat dry. I'm not using any soap. I'm going to monitor that area. I'm going to notify the doctor to see what the doctor suggests or recommends, and then we're going to update that order. 55. We have 15 more left. A medication aide may assist with which of the following? Is it A, administering IV antibiotics, B, applying medicated ointment, C, giving rectal Tylenol, or D, inserting insulin pens? Yeah, this one's super easy. I think I've drilled it in your head. You can do B. You can do topical. You can do eye drops. You can do ear drops. You can do oral medication. Some of your facilities, you can do enteral, but you can't do anything invasive. So medication aides may assist with topical medication applications. However, injections and suppositories are outside your scope of practice. 56, a medication is to be given PR. What does this abbreviation indicate? Is it A, orally, B, as needed, C, rectally, or D, by IV? So I need you to understand, as a medication aide, all of the residents, all of the patients' medications are on one MAR. You have to know the routes so that you know what medications apply to you. And so if you see something that says PR, that is not PRN. PR is per rectum. So that is C. PR, again, stands for per rectum, indicating that a medication should be administered via the rectal route, which you are not allowed to perform. 57. Which resident situation requires notifying the nurse immediately before giving a scheduled medication? Is it A, a resident with a mild rash on their arm? B, a resident with a blood sugar of 65? C, a resident with a blood pressure of 118/78? Or D, a resident that complains of having a dry mouth? Which would you notify the nurse about immediately? Revealing the answer in 3, 2, and yes, it is B, because a blood sugar of 65, usually less than 70 in some of your facilities based on that patient's condition, is considered hypoglycemia. So if it's 70 to 80, that's borderline. We're monitoring them. Let's go ahead and get them something to eat. But 65, maybe they've been NPO for a while. We need to make sure this patient's not about to have a hypoglycemic episode. So you get your nurse in the room, keep checking those blood sugar levels according to your facility's policies. But med aides must report abnormal blood glucose levels before giving anti-diabetic meds. So if you give an anti-diabetic med and their blood sugar is already low, you can bottom them out, causing their blood sugar to drop. Remember, the brain needs the sugar. When their sugar gets really low, they become very sleepy, hard to arouse. They can start becoming confused. They can begin sweating. And so that's when we say they're in a diabetic coma, is when they're unresponsive. So you always check blood sugar levels before you give oral anti-diabetic medications. And then your facilities, especially if a patient has diabetes, usually they will have these scheduled blood glucose checks where they'll say ACHS. And so AC refers to before meals and HS refers to bedtime. 58. Which of the following is one of the rights of medication administration? Is it A, right insurance, B, right diagnosis, C, right patient, or D, right physician? Yep, it is C, right patient. So I know earlier we talked about like 10 rights. Depending on where you are, there could be 5, there could be 10, there could be more than 10. But the main 5 are the right medication, the right patient, the right medication, the right dose, the right route, and the right time. But remember, early in this video, we discussed 10, and that is dependent upon where you work. But I think of the 10, I like the 10, the 5 or the main 5. But you also got to remember that, hey, if you gave a medication and it didn't have the right outcome or the right, the patient didn't improve, well, that would also be a right. And of course, the patient has the right to refuse. So learn the rights for your city, learn for your state, learn the rights for your school. But remember, in theory, there are 10 or more different rights to help you prevent medication errors. Question 59. What is the proper way to store medications? A, keep medications in a medication cart unless otherwise instructed. B, store medications in the resident's room for easy access. C, share medications between residents when running low. Or D, store medications with food items to save space. Yes, it is A. Medications must be stored securely and accessible only to authorized personnel, which is why we have medication carts. And when the medication carts are not in use, they're usually going to be locked in the med room. So we have med rooms, we have med carts, but we have multiple designated areas to keep those medications safe. Question 60. Which of the following situations may indicate possible medication diversion by a caregiver or staff member? Is it A, the resident reports feeling better than usual? B, medication counts are consistently accurate? C, PRN medications are charted but not signed out? Or D, controlled substances are missing without explanation? And so the key term in your question was medication diversion. What does that mean? What does it mean to divert something? All right. So it is D, everybody. So medication diversion refers to the misuse or theft of medications. usually controlled substances like narcotics. So unexplained missing medications, inaccurate counts, or altered documentation are all red flags. Diversion is a legal and ethical violation that must be reported immediately. So if you think that someone's diverting medications, remember the date, remember the situation, the circumstances, but you want to let your director of nurse know, your charge nurse know, because whether you know it or not, they start keeping records, and they will start monitoring the NARC counts more closely, especially on the days when that person's at work. I know some of you all are thinking, well, Eunice, why isn't it C? Because C, this was a medication error because they charted that they gave the PRN medication, but they didn't sign it out. But at least, we need to check with the patient to see if the patient actually got it. The patient say, yeah, she gave me the medication. Well, that wasn't diversion. That was a medication error, but it was not diversion, because at least somewhere they document that this patient received the medication. They may not have signed it out, but if we go in and we count and we see that one pill is missing, well, it obviously went somewhere. So a medication error by itself does not mean that someone diverted medications. Question 61. A home care resident is stung by a bee and begins having difficulty breathing. You know they have a prescribed EpiPen. What is the most appropriate action? Remember, home care, you and the nurse are rarely in the home at the same time. So you're in this house by yourself. Your resident got stung by a bee and they have an EpiPen. What do you do? Is it A, wait to see if symptoms improve? B, call 911 but avoid touching the EpiPen? C, assist the resident in using the EpiPen? Or D, crush an antihistamine and give it by mouth? All right, I see some great answers. And yes, you have it. So you all cannot give injections, but you can help that patient give their own injection. So the answer is C. In most states, med techs are permitted to assist with an emergency epinephrine auto injector, aka EpiPen, if it is prescribed and part of the care plan. Remember, you are not administering the injection, you are putting the EpiPen in your resident's hand. All right, so you're going to be helping them to self-administer their own medication in a life-threatening emergency. And then if you have to use the EpiPen, have your cell phone out, put it on speakerphone and call 911. So here it says, after use, always call 911. I'm sorry, as soon as I realize my patient's have an allergic reaction that's that severe to where they're wheezing, maybe their face is flushed, or saying they're having a hard time breathing, yes, they may have an EpiPen, but I'm using my phone at the same time as I'm holding their hand and helping them self-administer their epinephrine. So I think in an emergency, you'd be able to do both. You can always put that phone on speaker so that you don't have to hold it while you're helping to save your resident's life. Question 62. A resident appears confused, drowsy, and has shallow breathing. You suspect an overdose. What should you do first? A, take a full set of vital signs. B, stay with the resident and call for emergency help. C, leave the room to find a supervisor. Or D, try to get them to walk it off. I know, this one's tricky. They're confused, they're drowsy, they have shallow breathing. Do you want to get a full set of vital signs? Do you want to leave the room to get the supervisor? Or do you want to stay with them and call for emergency help? I would do B. You have to stay with them because these are classic signs of a drug overdose. So we're suspecting, hey, this patient, either the nurse gave them too much medication or maybe they took an illegal substance. And so if a patient overdoses, more than likely it was due to an opioid or a sedative. And so your immediate response is required. You're going to stay with the resident because what if they stop breathing? What if they go into cardiac arrest? You cannot leave them. You're going to stay with the resident, monitor them, and then you're, of course, notifying that nurse. And so there is a code button in your room. In your hospital settings, there's like this emergency button that when you press it, it alerts the entire floor, and it will get multiple people into your room. So if your nurse is a little slow getting to you, don't be afraid to activate that code button. Anyone can activate the code button, even family members. And again, never leave a resident who is injured, who's ill. Don't leave them alone. Stay with them, because again, if they go into cardiac arrest, we need you to start your CPR right away. 63, a resident is on 12 different medications, including blood pressure meds, sleep aids, and pain relievers. What term describes this situation? Is it A, polypharmacy, B, medication reconciliation? Is it C, multi-medications, or is it D, cross-tolerance? Right. I see we're torn between two different answers. So we're going to be revealing the correct response in 3, 2, and yes, it is A. It is polypharmacy. So that refers to the use of multiple medications by a single individual, often 5 or more. It increases the risk of drug interactions, side effects, and non-compliance, especially in older adults. The other term, multiple medications, that's just something I made up. And then medication reconciliation is when we check records. And so let's say a patient has a pharmacy. We need to get their list of medications from home. And sometimes they will have them, sometimes they won't. Worst case scenario, I can call the pharmacy. I can get that list of medications. And now I'm going to compare it to what records we have there in our facility. That comparison is called the medication reconciliation. We're reconciling the medications. We want to make sure they don't have duplicate medicines. So we're not going to have them take 2 medications that have the same effect unless the doctor specifically orders the medications to be given that way. Question 64. What is the proper response if a resident asks, what is this pill for? Remember your role. You're a med tech. Is it A, ignore the question? B, tell them it's none of their concern. C, inform the nurse so they can answer. D, answer their question. All right. Yeah, I know. I know you want to teach them. I know you want to answer their question, but you give the meds and the nurse answers the question. So it's C. Medication aides and med techs must stay within their scope of practice, which typically does not include explaining the purpose or mechanism of medication. So I'm going to go into the room. I'm going to introduce myself. I'm Eunice. I'm the nurse. Your doctor has ordered this particular medication. It says lisinopril. Lisinopril is going to help with your blood pressure. Your last blood pressure is 160/80. We want to bring that down to normal. And so a normal blood pressure would be 130/80. Do you have any questions about this particular medicine? Okay, well, if not, Cheryl is the med aide. She's the medication tech. She'll be in shortly with your lisinopril. Now, when you come in, you're going to be telling her what the pill is. But if she says, hey, why are you giving me this? You have to know that I've already explained that to her. So if a resident asks for a medication-related question, such as, what's this pill for? The correct and professional response is to refer the question to the nurse who is licensed and qualified to provide that information. You can say, hey, patient ABC, I thought your nurse was just in here and she told you that you're going to get a new prescription for lisinopril. And now the patient may be like, oh, now I remember. She said it was for my blood pressure. But you should not be doing the initial teachings. You just pretty much, you can remind them of what things are, but you don't want to go outside of your scope of practice. They're asking, what's this pill for? Try to refer them back to their nurse if possible. Question 65. A resident with COPD is prescribed oxygen at 1 to 2 liters per minute via nasal cannula. Their O2 sat reads 93%. I want to reread that. A resident with COPD, chronic obstructive pulmonary disease, is prescribed oxygen at 1 to 2 liters per minute via a nasal cannula. Their current oxygen saturation reads 93%. Can a med tech increase the oxygen flow? A says yes, increase to 2 liters per minute because there's an order. B says yes if they're short of breath. C, maybe. D, no, only a nurse or provider can adjust oxygen orders. Yeah, this one's tricky. But if you've been watching my other videos, it's not tricky to you. Because if you've been watching our videos, you know that you cannot adjust the flow of oxygen. I don't care if the order's there. That order is not for you. It's going to be D, you all. Oxygen's a drug that has to be regulated by nurses, respiratory therapists. It cannot be regulated by the med tech or the CNA. So med techs must never adjust the oxygen flow rate. And when I say specifically instructed by a nurse, if I'm a nurse, I'm not going to tell someone who, according to the Board of Nursing, is unlicensed to adjust the flow rate. It has to be an emergency where I am applying pressure. I cannot release my hands to turn a dial. That's how serious it has to be for me to tell a CNA or a med tech to adjust the flow of oxygen. So what happens whenever you adjust the flow of oxygen, depending on the patient's condition, like a patient with COPD, if you turn their oxygen level up, their drive to breathe will be decreased. So for them, lower O2 sats are normal. 90 to 93%, we're okay with that. They need low flow oxygen. They do not need high flow oxygen. So let me read that rationale. Med techs must never adjust oxygen flow unless specifically instructed by a nurse. Increasing oxygen without authorization can be dangerous for residents with COPD who rely on lower oxygen levels to stimulate breathing. So when you think about COPD, when you think about emphysema, think about those chronic smokers with the cough, that chronic cough that's really not productive. They cough a whole bunch. Those are the patients who are usually going to be on low flow oxygen, 1 to 2 liters. And so if the patient's on 1 liter and you feel as if, or the patient's requesting that it's increased to 2 liters, even though the order's present, you cannot change it. The nurse must come in, assess that patient, and then adjust the oxygen levels. 66, a resident with chronic kidney disease is ordered a diuretic. You should be alert for, so let's rewind, let's go back. Chronic means they've had it longer than 6 months. Kidney disease, what organs are we referring to? Of course, the kidneys. So maybe this patient's on dialysis. All right, so they are not able to excrete toxins. So a resident with chronic kidney disease is ordered a diuretic. You should be alert for which of the following. Would it be A, increased blood pressure, B, dehydration and low potassium, C, insomnia, or D, vision changes? All right, the answer is, drum roll please, it's going to be B, because we're giving somebody who has a problem with excreting things, if we're giving them a diuretic, let's make sure they can actually urinate. So diuretics increase fluid loss, which can cause dehydration and sometimes potassium. Potassium is excreted also. So it can cause electrolyte imbalances, especially hypokalemia, which refers to low potassium levels. Remember, if the potassium is too low or it's too high, it can cause the cardiac muscles to start misfiring. They're going to start firing faster or slower. In other words, it's going to cause an abnormal heart rhythm, which could cause cardiac arrest. So it is so important when we're like, hey, check the potassium level before you give potassium. It's really important because we have to know the normals. So a diuretic, it increases fluid loss. It also can cause an electrolyte imbalance, and that's going to be seriously dangerous for a patient with kidney disease. So if they have renal disease or kidney disease, we always say no K without P. K from the elemental table refers to potassium. P stands for urine. So no potassium if they're not able to pee. Hope that makes sense. Write it down. If it doesn't make sense now, it will make sense whenever you're out there in the field. Question 67. What should a medication aide do if the medication cart is left unlocked? Is it A, lock it immediately and report the incident? B, ignore it if it's not your responsibility? C, wait for the nurse to return? Or D, remove medications to keep them safe? We're almost done, team. I am so proud of you. And so the correct response is going to be A, okay, because unsecured medication carts pose safety and legal risks, so you're always going to keep them locked. 68, what does BID mean on a medication order? Is it A, give twice a day, B, give before dinner, C, only give the medication twice, and then D, excuse me, give twice per shift? What does BID mean on a medication order? All right, revealing the correct response in 3, 2, and yes, it is. Hold up, make sure I had the right one. It's A, that's right. It is give twice a day. So BID is a standard abbreviation meaning twice a day. And you all, if you go to nurseeunice.com, I will put that in the chat. It should also be in the description. That's where you get all of our freebies. And there should be one there on medical terminology. So if some of these terms were new to you, you can't be a medication aide, you can't be a med tech if you don't understand medical abbreviations. So make sure you go and get your free download. Just scroll down until you see one that says medical terminology and abbreviations. All right, question 69. A resident with Parkinson's disease takes cardidopa or levodopa. What should the med tech observe for? Would it be A, swollen ankles, B, less confusion, C, sudden weight loss, or D, improved mobility and reduced tremors? A resident with Parkinson's disease takes their levodopa. What should the med tech observe for? So you have to know something about your patients. You have to know their conditions. Patients with Parkinson's disease, they have a shuffling walk or a shuffling gait, and they normally have tremors. So if you're given a medication such as levodopa, what you're monitoring for would be D. You want to make sure they're improving, that their walk is improving, that they're not trembling as much. Now, what's sad about this is that this cycle repeats itself every day. When the medication wears off, they start having the tremors again. They start, their walk won't be as coordinated, or their gait won't be as coordinated. But that's why when you're given something, you have to know the reason that you're giving it. So this medication helps to control Parkinson's symptoms like tremors and stiffness. Med tech should monitor for symptom relief and side effects like dizziness. It would not be less confusion, because if your patient only has Parkinson's disease and they don't have dementia, they should not be confused. So don't start combining disorders. A person can have Parkinson's without dementia, as a dementia patient can have confusion without tremors and a shuffling gait. Question 70. A resident with GERD, G-R-E-D, is ordered Prilosec. What time of day should it be given? Is it A, after meals, B, at bedtime, C, 30 to 60 minutes before breakfast, or D, with an antacid? So that's omeprazole, aka brand name would be Prilosec. So when a patient's taking Prilosec, what time of day or how should it be given? Yes, it is C. So Prilosec is a proton pump inhibitor. It works best. So that means it's like reducing the acids. It works best when taken before meals to reduce stomach acid production. And let me tell you, I am so proud.
Are you a CNA who's looking to level up your career? Our qualified medication aide course gives you the training you need to start passing meds safely and confidently. If you're in Florida with 1 year of CNA experience, you can attend our qualified medication aide course. It includes 26 hours of online training, followed by 14 hours of in-person hands-on training with Nurse Eunice. Take the next step in your career. Enroll today at www.fltraining.com.
All right, so what is a medication aide? A medication aide, or a med aide, is a healthcare professional who assists licensed nurses in administering medications to patients in long-term care facilities, assisted living facilities, and other healthcare settings. They do not perform full nursing duties, but focus on safe and effective medication administration. The general requirements are subject to the state that you live in. Usually, the education is a high school diploma or a GED, a CNA license, usually with 1 year of experience. Training hours, depending on your state, it can be 60 up to 140 hours of coursework, but it's not like you're going to a college in order to be a medication aid provider. You would be going to a small training facility. The certification examination is given in-house, and you must pass a written test. In addition, you have to do a skills pass. They're going to watch you as you're giving out medications. And if you can give out medication safely, you would become a medication aid provider. Okay, so what types of medications are you able to actually administer? Oral, topical, eye drops, ear drops, and inhalants. Notice what is not listed there. Injectables and or enteral medications, such as if you were administering a medication via a PEG tube or a gastric tube, and also rectal medications. Understanding the different medications, this is really important. So as a nurse, it is hard to teach the med aid course because I am teaching laypersons, those who usually don't have a lot of medical experience, and CNAs, how to give medications, talking about the different classifications of medications, the side effects of medications, and on top of that, requiring you all to fill out a medication administration record or a MAR without making any mistakes. So the class is not an easy class to teach, but a lot of you all are successful. And the med aides in our state are making more than $20 an hour. And I'm in the state of Florida. And so that's with a CNA license. So understanding medications, you have to understand the classifications, the side effects, the interactions. You do have to do some medical math. So you have to understand dosage calculation, but just basic math, and you can utilize a calculator. What are your core skills that you're going to be tested on? Let's talk about the legal and ethical responsibilities. Of course, the basics. We have HIPAA, patient privacy, proper documentation, recognizing the scope of your practice. Are you going to be administering an intramuscular vaccine? No, you're a med aide. That's the nurse's job. Safety precautions, infection control measures, avoiding medication errors, and of course, communication, because those patients, they're going to have to build trust. They're going to have to build trust because it's like, hey, yesterday you were a CNA. Today you're giving me my medications, and I know you didn't go to nursing school. So the way that your demeanor, your professionalism is going to matter so much. And then let's talk about those state variations. Some states call medication aides by different titles, such as med tech or medication technician. In the state of Florida, it's a qualified medication aide or QMA. In some states, med aides can only administer specific medications or perform duties under strict supervision. All right, and so whenever you are going to be researching the med aid programs in your state, that's when you'll find out about your state's variation. So I'm not going to spend much time on that slide. So let's talk about the exam prep tips, because we're going to be going over some exam questions to help you understand your role and to help you better prepare for your experience when you are taking a med aid exam. So you're going to complete an approved training, study basic terminology or different medications. So we're going to discuss some of the common medications here, and I have a full video series that I'll be doing on medications within the next few weeks. Practice dose calculations. So go ahead and get your pencils and your paper, because you will have some calculations that we'll be performing during this live stream. And then understanding the documentation, familiarizing yourself with a MAR, reporting your errors, know your scope of practice, and then we're going to use practice tests such as this to help us succeed. So your job opportunities. Usually med aides do not work in hospitals. Med aides are going to be working in places that have a shortage of nurses. That's why we need you, because we don't have enough nurses to be given the medication. So those long-term care facilities, your assisted living facilities, your rehab facilities, sometimes adult care homes. That is where a med aide would usually be employed. All right, so want to learn more? You're going to go to your Board of Nursing's website for your state. You can also give them a call or send an email, and you're going to be looking for the Med Aid program requirements and to see if they can refer you to a program in your area. All right, so here we go, team. I know you've been waiting for this. Question number 1. What is the primary role of a medication aide? Is it A, diagnose medical conditions, B, prescribe medications, C, administer medications under supervision, or D, perform advanced medical procedures? And we're going all the way to 50 questions. So good morning, good morning, good morning. All right, revealing the answer in 3, 2, and if you chose C, you are correct. Medication aides assist nurses by administering medications to patients under supervision. They are not authorized to diagnose or prescribe. Question number 2, we talked about giving medication safely and avoiding errors. Let's see what you know already. Which of the following is not part of the 6 rights of medication administration? Is it right route, right patient, right dose, or right cost? Which is not part of the 6 rights of medication administration? And I'll reveal the answer in 5, 4, 3, 2, and if you chose D, you are absolutely correct. All right, so let's talk about those rights, and I'm going to also put them in the chat. So the rights are right person, right medication, the right dose, the right time, the right route, the right reason, and the right documentation. So depending on your source, there are more than 6 rights, but I'm going to repeat that so you can write it down. You need to know the right person, right medication, the right dose, the right time, the right route, the right reason, and the right documentation. Question number 3, when administering a medication, what is the most reliable method of identifying a patient? A, asking their name, B, checking their wristband, C, asking their roommate, or D, looking at their room number. All right. Let's see what answers we have. And I'll be revealing the correct response in 3, 2, and that is right, Rosalie and Danita and Alicia. Great job. It is B. We're going to look at those patient wristbands because their room numbers may change, or you could have a person who's confused. So you just going up to Mrs. Lucille and saying, hey, is your name Betty? She's going to be like, yeah, because she has bouts of dementia, confusion, etc. So you are to look at that armband. And then for those facilities that don't usually have armbands on their patients, they will have a paper chart that has like a picture. And if you are unfamiliar, this is your first time ever being in this facility, the best rule of thumb is to get the nurse to confirm the identity of patients if they don't have their armband. And then you're always using 2 identifiers. So it's not just, hey, is your name Betsy Jones? It's like, can you tell me your name and also your date of birth? And you would verify that with the information that's on the MAR. And again, the MAR is the medication administration record. That's what we use to document the medications as we give them. Question number 4, which of the following is an example of a transdermal patch? Is it A, eye drops, B, transdermal medication? Is it A, eye drops, B, inhaler, C, patch, or D, suppository? And I gave you that answer. I'm slipping this morning. So a transdermal medication is, of course, a patch. Okay, so it's going to be C. Transdermal medications are delivered through the skin, such as patches, and don't forget that it's not just going to be delivered through the patient's skin. If you put on a medication patch without gloves, you're going to be getting some of that medication too. So always make sure you use proper hand hygiene and to use gloves when you are administering medications. I know, Alicia, I gave out the answer. Question 5, a patient refuses their medication. What should you do next? A, force them to take it. B, try to convince them by arguing. C, skip the medication and move on. D, document the refusal and inform the nurse. Miss Nancy is not taking her Lasix today because it makes her pee and she doesn't want to be up on that toilet all day. She's missing the Price is Right. So what do you do? Reveal the answer in 5, 4, 3, 2. Yes, everybody got it right. It is D. You're going to document the refusal and inform the supervising nurse because that nurse maybe needs to go in and do some more teaching. All right. So we need to give you the Lasix because yes, it causes you to urinate, but you need that because your heart cannot take the excess fluid. So your nurse will go in and do some further teaching, and they will also show you how to document the refusal on the MAR. Question 6, which class of drugs is commonly used to treat high blood pressure? Is it anticoagulants, antihypertensives, antidiabetics, or analgesics? And so as a medication aide, we expect you to know all these big terms and you have to pronunciate the medications correctly. And so one of the hardest medicines for me to actually pronounce when I was a young nurse was hydrochlorothiazide. And it was like every patient was on it because I worked on a heart unit. And so I would literally be outside of the door of a patient's room saying that word repeatedly, hydrochlorothiazide, hydrochlorothiazide. So when I walked in the room, I seemed more knowledgeable and I was not tripping over my words. So everybody, we know that for question 6, you may say it's your blood pressure pill, but the true term is B. It's an antihypertensive. So an antihypertensive lowers blood pressure, helping to prevent complications like stroke or heart disease. Make sure you take the blood pressure before you give an antihypertensive. If we don't have morning vitals, they probably should not be receiving their medications because if their blood pressures are already low and you give them an antihypertensive, guess what you just did to the blood pressure? You lowered it even further. So vital signs and then meds. Question number 7. Which of the following is a common side effect of opioids? Is it constipation, increased energy, diarrhea, or rash? Do, 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 do. And what a way to start a Monday morning with a practice test. I love you guys and gals. And so, Danita, you have it. You're the first one who gave the answer. It is constipation. Look, when you give someone an opioid, a pain medication, it slows everything down. It puts them to sleep and it puts their organs to sleep. So the intestines are not moving. They're in a relaxed state. And so opioids can cause constipation due to their effect on gastrointestinal motility. In other words, it ain't moving, it's just getting stuck there. So whenever, as a med tech, as a nurse, when someone wants their medications for pain, I usually get them to get up and walk first. Because once I give you your medication, you're not going to want to walk. You're going to go to sleep. So, all right, Miss Lucas, let's get you up. I know you say you want your pain medication, but at least let's walk you to the bathroom first so that I can make sure that once you're back in the bed, you won't have to get up for a few hours. But that helps me walk them, move them around, get their guts moving a little bit before I give them their dose of medication that they're asking for around the clock. Question number 8. A patient with diabetes is prescribed insulin. What is your responsibility as a medication aide regarding this medication? A, mix the insulin with water before giving it. B, check the patient's blood sugar levels. C, inform the nurse so they can administer the insulin. D, document the patient's insulin dose on their care plan. And remember, for this one, you're acting in the role of a med aide, not the role of the CNA. So your patient is prescribed insulin. That's the key term, insulin. What do you do? Yes, everybody, it is C. That is outside of your scope of practice. You don't give injectables. So you're going to inform the nurse so they can administer the insulin. I know it was tricky to check the blood sugar, but that's usually a CNA role. So remember, right now it's talking about something that's not even within your scope of practice. You cannot give injectables. So notifying that nurse was the best response. And here's our rationale. Medication aides are not authorized to administer injections, including insulins. Their role is to support nurses by ensuring proper documentation, notifying the nurse when medications like insulin need to be given, and monitoring the patients for signs of distress. If a patient is prescribed insulin, the medication aide should inform the nurse so the insulin can be administered. And it's okay, Richard, if you're pretty rusty, it's 7 a.m. in the morning. All right, so everybody, paper and pencil or use your calculators on your phone. I need for you to convert grams to milligrams. And here's our question. Convert 2 grams to milligrams. Let's see if you remember your conversions. Go all the way back to high school for some of us. And for others of us, algebra. All right, so let's see. Let's do some conversions, revealing the answer in 10 seconds. 9, 8, 7, these are the slowest 10 seconds ever. 6, 5, 4, 3, 2, and so everybody, there are 1,000 milligrams in a gram. So in order to do your conversion, 2 grams would equal 2,000 milligrams. All right. So, and I see that some of you all got the answer correct. I'm proud that some of you tried. The other 20 of you were like, nah, it's too early in the morning, Nurse Eunice. We're not doing those conversions. But remember, write it down. 1 gram equals 1,000 milligrams. That's pretty easy to remember. All right. So we have another question number 10, because you want to be a medication aide. So that means that you have to learn some math. A medication label reads 250 milligrams per 5 mLs. How many milliliters are needed for a dose of 500 milligrams? Is it 1.5, 5, 10, or 20? Let's see, it's 250 and 5, and I need to give this patient 500 milligrams. How many milliliters, how many mLs do I give? And I'll give you 10 seconds. Let's see if you can get the answer right. 8, 5, and 1. So everybody, I want to teach you a little formula that we use. And the formula is D over H. So the dose that you have ordered over what you have on hand. So the dose that we have ordered was 500. What we have on hand is 250 times Q times the quantity. So it'd be times 5. So if you did that on your calculator, you would come up with 10 mLs. So if there are 250 milligrams in 5 milliliters and you need 500 milligrams, you would end up doubling the dose. So it'll be 10 milliliters total. And I want you, if you have your, I don't know if you're watching YouTube or this from your TV, but if so, just take a picture of this slide so that you can remember that formula, or you can just write the formula down, because that's going to help you answer so many of your calculations correctly. D over H times Q equals what you should be administering. All right, so true or false? Question number 11. After administering a patient's first dose of a new medication, the medication aide should monitor the patient for at least 10 minutes for any signs of an allergic reaction, such as swelling, rash, or difficulty breathing. What do you think, team? True or false? And now I'll reveal the answer in 5, 4, 3, 2, and I tricked you. It is false. It's not 10 minutes. That's not enough time. So, monitoring for 10 minutes is not sufficient to observe for potential signs of reactions such as swelling, rash, or difficulty breathing. Ensuring a longer monitoring period allows for a timely response to adverse effects. So you'll usually monitor them. It's not that you're in the room with them consistently for 60 minutes, but that once you start a new medication on a patient, you don't forget to go back and check on them. You just gave them a new medication for their blood pressure and you don't check on them again for 8 hours. Well, their blood pressure could have dropped or it may not work. So you have to go back and monitor these patients. So about every 15 minutes, just go back in and check on them. And then at the end, you would document medication given, no side effects, noted. Are they nauseated? Do they feel like they need to vomit? All of that would be important. If any of that occurs, you want to notify that to the nurse so that they can get advanced treatment. Question 12. In which setting are medication aides most commonly employed? This one's easy. Is it assisted living facilities, hospitals, surgical suites, or psychiatric hospitals? Okay, and I'll reveal the answer in 3, 2, and yes, you have it. It is A, assisted living facilities. Remember, usually it's going to be a place that doesn't have enough licensed nurses, whether that's LPNs or registered nurses, because if they did, those nurses would be given the medications, not a medication aide. Question 13. Which law protects patient confidentiality and privacy? Another easy one. Is it the Patient Protection Act? Is it HIPAA, OSHA, or the Safe Staffing Act? And revealing the answer in 5, 4, 3, 2, and yes, it is HIPAA. It is B. And HIPAA stands for the Health Insurance Portability and Accountability Act. And that's where we get our confidentiality laws from. It ensures that patient health information remains private. Question 14. What should you do if you witness another aide giving medication without following proper protocol? Well, the nurse isn't available and she needs her insulin, so I'm just going to give the insulin. Do you A, ignore it, B, discuss it with the patient, C, report it to the supervising nurse, or D, administer the medication again? Yes, remember, even though you are staying within your scope of practice, sometimes people forget that they are not a nurse and they're going to be doing things that they shouldn't be doing, which jeopardize patient care. And so the correct response for 14 is going to be C. Report unsafe or improper medication administration to the supervising nurse, ensuring patient safety and upholds the ethical standards. Question 15. Which route of medication administration involves injecting medication directly into a muscle? Is it A, subcutaneous? Is it B, muscular? Is it C, intravenous? Or is it D, intramuscular? Let's give you a few moments and we'll reveal the correct response in 5 seconds. 4, 3, 2, and yes, Danita, you have it right. It is D, intramuscular or IM injections deliver medication deep into the muscle, often used for vaccines or pain medication. And Qualzem, you have it right also. And I know there can be a delay based on where you are viewing from. Sometimes YouTube shows the questions a little bit faster than some of the other platforms like Facebook. Okay, question 16. Which type of medication is used to lower blood sugar levels? Is it anticoagulants, antipyretics, antidiabetics, or antihistamines? So you're learning about your classifications of your different drugs. All right, revealing the answer in 5, 4, 3, 2, and C. And Freya, hope I pronounced that correctly. Alicia and Danita, you have it right. So it's not like I'm going to give you your diabetes pill, because that's like you're giving someone diabetes. It's an anti-diabetic medication, such as insulin, glyburide, metformin. Glyburide and metformin are oral anti-diabetic agents. So not every diabetic is going to require an injectable such as insulin. Some can take pills. But those medications are used to lower blood sugar levels in diabetic patients. Question 17. What is the first step when receiving a new medication order? A, document it in the medication administration record, aka the MAR. B, administer the medication immediately. C, verify the order with the nurse. D, ask the patient if they want to take the medication. All right, so you just received an alert. Back in the day, it was a fax, but you just received an alert electronically, email. Hey, we have a new medication order. What are you going to do with it? Revealing the answer in 5, 4, 3, 2, and Charlene and Sandy, you have it. You need to go talk to the nurse just in case. So the answer is C. When receiving a new medication order, the first step is to verify the order with the nurse. This ensures that the order is accurate, complete, and appropriate for the patient. What if the nurse didn't even know the doctor ordered it and you walk in with a pill that the patient wasn't even expecting? Let the nurse be made aware first so that they can go back and follow up. Administering the medication immediately without verification could lead to serious errors, especially if the order contains a mistake. Question 18. When should medication administration be documented? A, at the end of the shift. B, during the next staff meeting. C, after the medication is administered. Or D, before administering the medication. So when do you want to document? All right, sorry about that. I had to open up my blind. I prefer natural light. All right, and so you all are absolutely correct. You want to document medication administration after you have given the medication. So it's going to be C. Medications must be documented immediately after administration to ensure accurate records. We have another math question. This one's easy. A physician orders 0.5 milligrams of a medication, and the tablets that are available are 1 milligram each. How many tablets would you administer? Would you administer 1 tablet, 0.5 tablet, 2 tablets, or none? Remember our equation. The ordered dose over what you have on hand times the quantity. Here the quantity would be 1. All right, revealing the answer in 5, 4, 3, 2, and yes, Qualzam, you got it. It is B. Since each tablet is 1 milligram, administering half a tablet, 0.5 milligrams, fulfills the order. And here I have an image of a pill splitter. It would probably be best if they just had the pills in the correct in the correct dosage, but sometimes you'll see a device like this that and some of the pills are already scored. So this would be an easier way for you to break a pill to ensure that it was scored evenly. Question 20, true or false? If a patient reports difficulty swallowing their medication, the medication aide should crush the pills and mix them with applesauce without consulting the nurse or checking the care plan. You're welcome, Alicia. What do you think is the safest for your patient? And that is right. We're getting the correct responses, everybody. That would be false because every medication should not be crushed. So some medications are time released or coated and should not be crushed. The medication aide must consult the nurse and check the care plan before altering how a medication is administered. This ensures the medication is given safely and effectively. So imagine if you crush a medication that is supposed to be um, absorbed or metabolized over an 8-hour period, but you just take it and crush it. So the patient gets the full effect of that medication in 30 minutes to 1 hour. So that's why you just don't go and randomly crush pills. You want to check with your nurse first. Or again, maybe the nurse should call the pharmacy or the doctor and request a different, maybe formula or a different type of medication. Question 21. What is the most common side effect of antibiotics? Is it rash, drowsiness, nausea and diarrhea, or high blood pressure? All right, revealing the answer in three, two, and yes, it is all of those GI issues. So it's going to be C. Antibiotics frequently cause gastrointestinal effects like nausea and diarrhea. Some, you make sure you read well. Some should not be taken with milk products. Some should not be taken with alcohol. So you want to make sure that you as a med aid provider know all of this and that you actually read those little pharmacy pamphlets or leaflets that they send with the medication, because you're going to be responsible for also educating and monitoring the patient for these side effects. Question 22, true or false? When a patient begins to show signs of hives and itching 15 minutes after taking a prescribed antibiotic, the medication aide should give the patient an antihistamine immediately to treat the allergic reaction. This one's tricky. True or false? And I'll give you 10 seconds to enter your comments in the chat. Almost everybody got it right. It is false, you all. Remember, you are not a nurse. So medication aides are not authorized to administer medications like antihistamines without a specific order and approval from a nurse or a healthcare provider. The appropriate action is to notify the nurse immediately and monitor for worsening of symptoms, because you all may be trying to give, let's say you're trying to give Benadryl, and the only thing that you would have access to would be a liquid form or maybe a pill. If you notify the nurse can get an order from a doctor to give IV medications, IV antihistamines, IV corticosteroids. So you want to include the nurse in that conversation so that we can make sure the patient gets the best treatment, the one that's going to work the fastest for their hives. Question 23. What is the best way to prevent medication errors? A, rely on memory. B, administer medications quickly. C, follow the 6 rights or however many rights there are of medication administration. D, ask patients for instructions. And this one's so easy. I'm only giving you 3 seconds, but it would be great if you all could try to recall the at least 6 rights of medication administration. So I'm revealing the answer in 5, 4, 3, 2, and yes, it is C. Adhering to the 6 rights: right patient, right medication, dose, route, time, documentation, and then the 7th will be reason. If you administer or if you adhere to those, that's going to help you minimize those errors. 24, why is it essential to observe patients during and after medication administration? And I know Alicia is going to have this one. Is it A, to ensure the medication is taken correctly? B, to monitor for adverse reactions or side effects? C, to ensure the medication is not misplaced or shared? D, all of the above. What do you think, team? Alhaji, Tico, Sandy, Danita, Jerlyn, Qualzim, Rosalie, Chrissy, what do you think? you all got it, because some of these patients will divert their medications. It will look as if they're swallowing it, and then they take it out from beneath their tongue and they will sell those narcotics. So the answer is D. Watching the patient during this process ensures their safety, avoids complications like choking, and guarantees the prescribed medication is administered properly. Question 25. Before giving a medication, you notice that the label is smudged and unreadable. What should you do? A, call the pharmacy and request a new label. B, administer it and document later. C, do not administer the medication and report it to the nurse. D, guess the medication based on past experiences. So when might this happen? When there's a liquid medication and you've been pouring the medication towards the label, and the medication has now gotten on the label. We've cleaned it off multiple times. So whenever you're pouring those liquid medications, do not pour towards the label area that shows the dosage, etc. Maybe pour the opposite way. And I hope that makes sense, so that it's going to be less likely to smudge the letters. All right, everybody, revealing the answer in 3, 2, and you got it right. I'm so proud of you. That one was an easy one for you all. It is going to be C. Medications with unclear labels should not be administered. Always report such issues to the nurse to ensure patient safety. And part of your med aid course, they're going to teach you not only how to read the prescriptions, but most of our prescriptions are now sent electronically directly to pharmacy. But the prescription or the order, and then also the label on the medications, which should include, of course, the pharmacy's name, information, the provider, the ordering doctor or nurse practitioner, their information should be on there, the patient's information, and also, without abbreviations, the actual directions. So for example, in this particular image, it says take 1 tablet by mouth every 12 hours. And then it gives you more information. Take the medication with food. This medication may cause drowsiness. So now you got to put your CNA cap on. And so if while you're in the room, this patient asks to use the bathroom, you're just not going to get her up quickly, because you're giving her medications that may cause drowsiness, that may cause her to become dizzy. So you have to put your whole, medication aid hat on, but also remember that you're still a CNA in some aspects, and that you're just not giving medication to a patient who's just going to lay there all day. They're going to get up. So the teachings that you actually provide do matter. Question 26, we're almost to 50, team. Why is it important to educate patients about their medications? A, to reduce medication errors. B, to prevent them from refusing medications. C, to eliminate the need for documentation. D, to improve compliance and understanding of the treatment plan. All right, let's see those responses. Revealing the answer in 3, 2, and of course, you all got it right. It is D. Educating patients enhances their understanding and compliance with the prescribed treatment. 27. Which of the following is an example of a medication error? A, administering a medication 15 minutes late. B, giving the correct dose at the wrong time. C, verifying the medication label 3 times. D, documenting after administration. Which is a medication error? And I love it. It's so beautiful today. The birds are chirping. I think it's going to be 70 plus degrees in Florida. I do hope that winter hurry up and leaves. I miss the beach. I miss walking along the river, and I don't want to do it when it's cold outside. So everybody, revealing the answer in 3, 2, and it is B. Administering the correct dose at the wrong time is a medication error, and it should be avoided. So remember those rights. You have to give the medication at the right time. Question 28, which of the following must be checked before administering digoxin? All right, so is it going to be blood glucose levels, respiratory rate, blood pressure or apical pulse. And if you have pen and paper, I want you to write this down because you're going to be given this medication a lot. A lot of patients are on digoxin. All right, we'll give you 10 seconds to see if you can come up with the answer. What do you monitor before giving digoxin and why? The whys are always important. And I see one correct answer. C has it. It is D, everybody. It is not blood pressure. Digoxin is not an antihypertensive. So the answer is D. Digoxin can slow the heart rate. So the apical pulse must be checked to ensure it is safe to administer it. So the apical pulse, when you look in the image, that is where you would place your stethoscope. So as a CNA, you would palpate the radial pulse for 1 full minute. But as someone who's given medications, somebody with advanced training, you need your little fancy stethoscope. Plus, you're going to be giving inhalers anyway. You're going to be giving people their asthma medications. So you're going to put the stethoscope on the chest where it shows in the image, and you're going to be listening to the heart rate for 60 seconds. Do not skip. Do not listen for 15 seconds and multiply by 4. Because if this patient's heart rate is lower than 60 and you give digoxin, which lowers the heart rate, you can cause your patient to have some immediate symptoms, and they can also become digitoxic, which can make their heart rate be slow for a prolonged period of time. So digoxin slows the heart rate. Question 29. A doctor orders 75 milligrams of a medication. The medication is supplied in 25 milligram tablets. How many tablets will you give? Is it 4, 3, 2, or 1? All right, I see some answers coming through. Let's see if we can get 2 more responses before we move forward. All right, I'm revealing the correct answer in 3, 2, and if you chose B, 3 tablets, you are correct. And so there's that formula again that I want you to take a picture of, or that I want you to write down. So divide the ordered dose, 75 milligrams, by the strength of 1 tablet, 25 milligrams, to determine the number of tablets. So 75 divided by 25 equals 3 tablets. Question number 30. Which of the following could be a sign of medication diversion? Someone is stealing medications. A, unexplained discrepancies in medication counts. B, frequent complaints. Oh, let's talk about medication counts. When you're giving out narcotics, usually at the beginning of your shift, you and the offgoing med aide would count the number remaining. And then whenever you're leaving, the oncoming med aide, you and that person would do another count. And so unexplained discrepancies in medication counts. B, frequent complaints of loss or missing medications by a coworker. C, a coworker volunteering to administer controlled substances frequently. Or D, all of the above. And fun fact, you all, the Wegovy and all of those anti-diabetic medications that people are using for weight loss, and most of your facilities, now they're locking those down too. Those have to be controlled because somehow the medications are being diverted. Your nurses are getting thinner, but your patients' blood sugars are not being controlled because they're taking those medications and administering in themselves. At least that's what the reports say. So don't divert drugs. Yes, the answer is D, everybody. All of the above. Medication diversion can manifest in various ways, including unexplained discrepancies in medication counts, frequent complaints of missing medications. Oh, I dropped a pill again. Well, dang, Mary, you drop a pill every day. And unusual behavior, such as coworker frequently offering to administer controlled substances. These signs should be taken seriously and reported to a supervisor for further investigation. Recognizing these patterns is critical in preventing harm to patients and maintaining the integrity of healthcare practices. Yay! I hope you're as excited as I am. There's another medical math question. So, a vial contains 100 milligrams of medication in 2 milliliters, 2 mLs. So, 100 milligrams in 2 mLs. How many milliliters will you need to give if the dose is 50 milligrams? This is easy. Is it 1 milliliter, 1.25 milliliters, 1.5 milliliter, or D, 2 milliliters? So, all right, revealing the answer in 3, 2, and yes, Chrissy and Rosalie. You got it right. It is A. So to calculate, divide the dose needed 50 by the concentration. And that was 100 milligrams in 2 ml. So remember that D over H times Q? And if you do that, you're going to end up with 1 ml. So when would this pretty much come into play? When you're giving out pediatric medications, those liquid suspensions. So your pediatric syringes, those will have like it may have like 0.5, 0.25. And so that's when pulling out the correct dose is really, really, really important, because you definitely don't want to be giving a child too much medication. And don't forget that as a qualified medication aide or a med tech, some of you all will be working in assisted living facilities. So you may, in group homes. So you may have to give medications to pediatric patients also. Just a thought. Question 32. What must you include when documenting medication administration? A, only the name of the patient. B, the patient's name and date of birth. C, the nurse's name and initial. Or D, the time, dose, route, and any observations. All right, revealing the answer in 3, 2, and it is D. Yes, Rosalie. Accurate documentation includes all of those things listed. Don't forget to include your initials on the MAR, and you will also have to sign at the bottom of the MAR. And so I know this is hard to see, but this is a sample MAR. It at the very top, this is where you would write in the resident's name, and usually you would include more information like their date of birth, maybe the medical record number. We would put a label there. Okay, just depends on where you are. If this is a brand new patient, you all don't have labels for them yet, you would handwrite it and then of course put a label on top whenever you receive the labels. And now the month/year, and then you would enter legibly. You would enter the medication in the box, put the entire doctor's order. Digoxin, 0.25 milligrams. You wouldn't put TID or QD or BID. You would write down exactly what it says, 1 time per day. And then hold if heart rate is less than 60. Everything the doctor put on the order, you would put in that medication box. And then for our morning medications, usually it's always going to be at either 6 a.m. or 9 a.m., depending on whether or not the medication needs to be taken with food or without food. And then, etc. So your facilities will teach you the time. And so this initial MAR is what you would use, the one that's handwritten, up until the time that the pharmacy delivers the one that is computer generated. And a lot of your facilities, usually within 24 hours, you would have the computer generated MAR. So this would be a sample MAR. And at the very bottom, it would give you a place to sign and to also the legend. So if a patient maybe refuses a medication or if something's late, you would know what to put in the box. Because if you initial it, that means that you gave it. All right, so question 33. Why is it important to check a patient's gag reflex before giving medications? A, to ensure the patient is alert and oriented. B, to determine if the medication should be crushed. C, to check for an allergic reaction to the medication. Or D, to prevent choking or aspiration. Why do you check the gag reflex? All right, revealing the answer in 5, 4, 3, 2, and yes, it is D, to prevent choking or aspiration. Look, you've never worked with this patient before. You're going in there and they're kind of stuporous. They're barely talking to you. The previous med aide says, yes, I gave her medication without any issue. You're going to sit her upright and be like, okay, let's verify your identity, blah, blah, blah. You're going to get a tongue depressor and you're going to say, all right, let's say ah, and you're going to stick that tongue depressor. You're not trying to make them gag. You're not trying to be mean with it, but you're going to stick it as far back into the back of their throat as they can tolerate. If that person moves, or if they say, oh, that means that they have a gag reflex. If there is no movement, if the patient is letting you be back there in the back of their throat and, they're unconcerned, that would be a cause of alarm. So checking the patient's gag reflex ensures that they can swallow safely without the risk of choking or aspiration. If the gag reflex is weak or absent, the patient may not be able to protect their airway, which could cause serious complications such as aspiration. Notify your nurse. Question 34. Which of the following is an example of a medication aide working outside of their scope of practice? A, administering oral medications. B, changing a resident's care plan. C, documenting medication administration. D, reporting medication side effects to a nurse. Which is outside of your scope of practice? All right, revealing the answer in 3, 2, and that is correct. You have it there. You cannot change or modify the care plan. That is done by nurses and doctors. You can add your information to it. You can add updates, but you are not responsible for initiating or changing the care plan. Question 35. What should a medication aide do if a medication drops on the floor during administration? A, pick it up, clean it, and give it to the patient. B, discard the medication and document the incident. C, inform the nurse and request a replacement dose. D, both B and C. All right, I'm seeing some varying answers coming through. Let's see if we can get 2 more responses. Yes, let's see. Chrissy, Vadim, Elvianes, and Danita, you have it. It is D. It is both B and C. So if a medication drops on the floor, it must be discarded to prevent contamination and potential harm to the patient. But especially if it's a narcotic or a high-risk medication, you're going to discard that in the presence of a nurse. The medication aide should document the incident and inform the nurse to obtain a replacement dose, ensuring the patient receives the correct medication safely. Administering a dropped medication is never appropriate. So we don't do the 3-second rule in healthcare. If a pill touches the floor, we're going to discard it. Question 36. A patient taking anticoagulants like warfarin should avoid which of the following? A, foods high in vitamin K. B, dairy products. C, foods high in protein. Or D, water. And this is encouraging me. It's exciting me to do that video on medications, because if you don't know what warfarin is, you're going to add that to your little notes. I'm having you take notes today with formulas, with different medications. Warfarin is also known as Coumadin. So if someone's taking Coumadin, what should they avoid? Revealing the answer in 3, 2, and Sandy, Chrissy, and Elvianes, you all have it. It is A. They have to avoid those green leafy vegetables because they are high in vitamin K, and those would counteract the effects of anticoagulants. So anticoagulant makes it so that your blood is thinner, so it can flow to those vessels, so we can prevent strokes, etc. But if you start eating a whole bunch of collard greens and spinach and you haven't been doing that before, well, vitamin K causes you to clot. So it's going to counter the effects of the medication that we're giving you in order to help save your life, to prevent a future stroke, to prevent blood clots. Question 37. How should a medication aide document a patient's refusal of medication on the medication administration record? A, leave the section blank to avoid confusion. B, cross out the medication entry for that time. C, write refused in the comment section and notify the nurse. D, document the refusal in the patient's medical record only. All right. Revealing the answer in 3, 2, and it is C. Great job for you all who chose C. So usually there's a legend where maybe like R means refused. They're going to show you what to put in that box, but you never want to leave a box blank. So when a patient refuses a medication, it must be documented on the MAR to ensure accurate record keeping. Writing refused in the appropriate section and notifying the nurse allows the healthcare team to address the patient's concerns or needs and make adjustments to the care plan if necessary. Leaving the section blank or crossing it out can lead to confusion and errors in patient, let's see what that says, patient care. Question 38. And if you've been with us this far and you haven't liked the video or subscribed to our channel, please go ahead and do so. All right, we appreciate you all so much. So question 38. A patient is receiving dialysis at the scheduled time for their medication. What should the medication aide do? And how much time do they have to administer the missed dose after dialysis? Is it A, skip the dose entirely and continue with the next scheduled dose? B, administer the dose immediately after dialysis and document the time? C, notify the nurse and follow the facility policy, which may allow administration within a specified time frame? Or D, administer the medication at the next meal to make up for the missed dose? So this patient was in dialysis. They missed their scheduled dose of medication. What is the safest thing to do? Revealing the answer in 5, 4, 3, 2, and I am so proud of you all. You make my heart smile. You all gave me the right information. I am so proud of you. So yes, everybody, it is C. When a patient is unavailable for a scheduled medication due to dialysis or whatever, maybe they're having a medical intervention, the medication aide must notify the nurse and follow the facility's policy regarding the missed dose. Many facilities have a grace period, commonly an hour before, an hour after. So if a medication is due at 8, but if you give it between 7 and 9, you're good. So during which the missed medication can be administered, but this depends on the type of medication and the patient's condition. The nurse will provide guidance to ensure the medication is safely given when appropriate. Skipping the dose entirely or deciding on timing without consulting the dose, without consulting the nurse can lead to errors or harm to the patient. And as a nurse, I would simply follow the facility guidelines. And if there aren't any that addresses that specific medication, I would give a quick call to the doctor and get in order to give the medication or to hold the medication. Question 39. What is the first step in preparing to administer medications? A, check the physician's order. B, wash your hands. C, identify the patient. Or D, gather the medications. When you're taking these tests, always think about safety. What is the safest first step in preparing to administer medications? All right, revealing the answer in 5, 4, 3, 2, and I see a lot of you all have your CNA hats on. Remember, you are now giving medications to a person. So while washing your hands is important, Check the physician's order. Yes, that is the safest thing to do. So the first step in medication administration is to check the physician's order to verify the correct medication, dose, route, time, and patient. This ensures the medication aide is following the provider's instructions and prevents errors. Washing hands, gathering medications, and identifying the patient are essential subsequent steps, but they occur after confirming the order is accurate and appropriate. Administering the medication without verifying the order first could lead to significant errors and harm to the patient. So once the order has been confirmed, then yes, the first step will be hand washing. But just make sure if there's ever a test question that mentions checking the doctor's order, that would be my first step. And for some places, it may not be a doctor's order. It could be the physical prescription that was sent from the doctor. Yes, you can, Danita. Question 40. You notice that a patient is unable to swallow their oral tablet. What should you do? A, crush the tablet. B, skip the dose and document it. C, consult the nurse to adjust the medication form. D, dissolve it in water immediately. And I know that you all know this answer because we've already talked about it. So I'm revealing the answer in 3, 2, and we're going to do C. You got it, Rosalie and Al-Haji. You have it. So only the nurse or prescriber can authorize changes to the medication form. And so I have here 2 different types of pill crushers. You must have approval to crush a pill to alter its form, because if a pill needs to be crushed, more than likely that patient needs a whole different formulation. Maybe they need a liquid, a suspension. So if you are able to crush a pill, the smaller one is the more silent one, the little twisty one. You just twist, 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 crush the pill. You still have to keep the pill separate. You can't crush 20 pills and put them all in one cup because they could cause a reaction. So even if you're crushing pills, you still have to give them individually. The bigger one, the one that says Silent Night, oh, that's the stress reliever right there. You just crush it, crush it, crush it, crush it. All right, I'm enjoying that too much. But yeah, so depending on what facility you're in, you may have either of these pill crushers. But again, we don't crush everything. And then once it is crushed, we don't mix it all together because we don't want our patients having an upset stomach. Question 41. What is the first action to take if you realize you have given a patient the wrong medication? A, inform the patient about the error. B, document the error immediately. C, report the error to the supervising nurse. D, try to correct the error by giving the correct medication. Let's see what answers we have. Revealing a response in 3, 2, and Dernita, Jerlyn, Rosalie, Chrissy, you have it. Notify that nurse. It is C. Medication errors must be reported to supervisor nurse immediately to ensure patient safety and proper corrective action. Question 42. Why is it inappropriate to mix crushed medications into an entire container of applesauce? A, mixing medication with food is never allowed. B, the medication's effectiveness may be reduced when mixed with applesauce. C, it violates infection control protocols. Or D, the patient may not consume the entire portion, leading to an incomplete dose. Got to put your thinking caps on for this one. I know what you want to do, but what you want to do is not always the correct thing to do. So are you going to open the lid on the applesauce container and pour your crushed medication into that entire container of applesauce? No, you're not, because Qualzam, Luigi, Chrissy, looks like they have the right answer. Because if you do that and they don't eat that entire cup of applesauce, it's going to be D. They may not consume or get enough of their medication. So what do we do instead? We have a medication cup that we put applesauce in, a little small medication cup. We put applesauce in that and then mix their pills in that. And with 1 or 2 bites of food, swallows, they're going to take all of their medication with a smaller portion of applesauce. That way they have their entire container of applesauce later to enjoy. So crushing medication and mixing it into an entire container of applesauce can result in the patient not consuming the full dose, which may reduce the medication's effectiveness. It is essential to mix the crushed medication with only a small, manageable portion to ensure the patient receives the correct dose. While mixing medications with certain foods like applesauce is allowed when appropriate, it must be done in a way to ensure the full dose is administered. The same way when you're giving medication to a baby. You don't put the whole, the entire dose of medication in a huge baby bottle, 8 ounces. The baby may not drink all of that at one time. So you would instead take a smaller amount, maybe just like the very top, the nipple of the bottle, and you would put a little bit of the milk in that mixed with the medication. So when the baby sucks, immediately the medication and the milk goes down. All right, so question number 43. When administering eye drops, what is the correct technique to avoid contamination? Remember, you all can do oral, you can give ear medications, eye medications, topical medications. So when you're giving eye drops, do you want to do A, touch the tip of the dropper to the patient's eye for accuracy? B, rest the dropper on the patient's cheek to steady it? C, hold the dropper above the eye without letting it touch any surface? Or D, apply eye drops to both eyes just in case the infection spreads. I know what you do at home. But those patients are not your kids. So what do you do? What's the correct response? And so for those of you all who chose C, not B or D, you have it. So you don't want that dropper touching the patient's eye. It's going to get contaminated. And you don't just want to be creating your own orders. If the doctor has ordered that this medication is given in the right eye, you don't want to be like, hey, let me just go ahead and put some in the left eye also, just because. So the dropper must not come into contact with the eye, eyelashes, or any surface to avoid contamination and reduce the risk of infection. Proper technique ensures patient safety and maintains the sterility of the medication. Question 44. What should you do if a patient questions the medications you're about to administer? Get an attitude. That's what y'all like to do. Just joking. Don't do that. A, ignore their concerns and administer the medication. B, double check the medication and order before administering it. C, ask the patient to consult the doctor. D, explain that patients cannot question prescribed treatments. All right, so you are a CNA for 3 years, and now you've been a qualified medication aide for 2 days. And Miss Lucille is questioning the medication. It does not look like her regular pills. What do you think the best response is? Yes, Al-Haji. Yes, it is B. Patients have the right to question their treatment. Double checking ensures accuracy and builds trust, because sometimes the manufacturer, the distributor, may not, let's say last time we're getting our medications from company A. But this month we had to get these medications from company B because of insurance reasons, what have you. And company B's, even though it's the same medication, the same formulation, the pill is shaped differently and it's a different color. These patients are creatures of habit. So if they have a question regarding their medication, answer their question. Be respectful, because they could, number one, catch a medical error that maybe the pharmacy sent the wrong medication, or 2, you'd be able to educate them and tell them the reason why the pill looks different is because we switched to another supplier. Question 45. What should a medication aide do if they encounter an illegible medication order? You can't read it, sloppy handwriting. A, guess the medication dose based on the patient's previous orders. B, administer the most likely medication to avoid delays. C, skip the dose and document that the order was unclear. D, notify the nurse or supervisor to clarify the order. And I'm revealing the answer in 5, 4, 3, 2, and yep, D's the safest answer. Notify the nurse so she can contact their provider. Hey, Dr. Jenkins, you wrote an order. I can't read it. Can you please clarify this order for me? So if the medication order is illegible, the medication aide must notify the nurse. Administering medication without understanding the order could lead to serious errors and harm to the patient. Guessing or skipping the dose without clarification is unsafe and violates medication administration policies. Ensuring clarity before proceeding protects both the patient and the healthcare provider. Don't forget, you're giving medications. Not only can you be sued, you can go to jail. So make sure you understand what you are giving before you give it. Question 46. What is the correct way to administer eardrops to an adult patient? A, pull the ear upward and back to straighten the ear canal. B, pull the earlobe downward and administer the drops. C, place the drops in the ear and have the patient sit upright immediately. Or D, administer the drops and clean the ear canal with a cotton swab. Oh, you all have me so encouraged. Maybe I should teach med aid classes again. I stopped teaching them because I teach so much, but who knows? Who knows what 2025 will hold? All right, everybody, revealing the answer in 5, 4, 3, 2, and it was A. All right, so let's talk about it. For adults, you pull the ear up and back. For pediatric patients, you pull the ear down. So for adults, pulling the ear upward and back helps straighten the ear canal, allowing the medication to reach the intended areas. After administering the drops, the patient should remain in a tilted position for a few minutes to ensure proper absorption. So you just don't have them sit up immediately. Using cotton swabs in the ear can push debris further in and is not recommended. Question 47. What is a common condition treated with buccal medications? Is it tooth decay, angina or chest pain, also referred to as angina, skin infections, or sinus congestion, which I have right now? So buccal medications, what in the heck does that even mean? But as a medication aide, you can give it, so you have to know. Revealing the correct response in 7 seconds. 7, 6, 5, 4, 3, 2, and drumline, please. If you said B, you got it right. So great job there, Chrissy and Elvia Niz. So buccal medications like nitroglycerin tablets are placed between the cheek and the gum. They can also sublingual, could go under the tongue to quickly relieve chest pain caused by angina. So those are not something that needs to be swallowed. They're going to be placed in the cheek or under the tongue and absorb quickly into the bloodstream that way. Question 48. Which condition is typically treated with topical antifungal medications? All right, so you all, I need to just take a quick pause to say, congratulations, Rachel. I am so proud of you. All right, so everybody, if you have a time, would you please say congratulations to Rachel? All right, so question 48, which condition is typically treated with topical antifungal medications? Is it eczema, bacterial infections, seasonal allergies, or athlete's foot? Did you all know that a medication aide could do all of this without going to college, without being a nurse? Yes, you take a 40-hour class, a 60-hour class, depending on where you are in the country, and you could be certified to give medications usually requires 1 year of experience as a CNA first. And so if you chose D, yes, you get to play with your patient's footsies and you get to put on some gloves and apply the antifungal creams that are used to treat athlete's foot, etc. on their body. You have been elevated. Welcome to the team. Question 49. Which type of medication is commonly used to treat asthma? Is it A, oral antibiotics, B, nasal decongestants, C, inhaled bronchodilators, or D, topical analgesics? Revealing the answer in 5, 4, 3, 2, and you have it correct there. Oh, Haji, where are you viewing from? Because your answers are coming first. So I think it just depends on where you're watching from and you won't have such a delay. But for all of you all who used inhaled bronchodilators, aka their asthma pump, you are absolutely correct. So it is C. The bronchodilators relax the muscles around the airways, making it easier for patients with asthma to breathe. Question 50. A patient has a wound that requires local pain relief. Local is the key word. Which type of medication would be most appropriate? All right, Al Haji in New York. Is it A, oral analgesic tablets, B, topical anesthetic cream, C, nasal spray, or D, buccal tablets? Revealing the answer in 5, 4, 3, 2, and no answers are coming through yet. Let's give you a few more moments. Looks like Rosalie and Danita, you have it, because if it's local, we're going directly to the source. We're not going to give them a pill that has to be metabolized and digested. Where if you're having pain in a certain spot, we're going to put the numbing ointment right there on that spot. So when you think of topical anesthetics, think of lidocaine, xylocaine, whatever it is. Some are available over the counter. Some, of course, would be prescription based. But topical anesthetic creams are applied directly to the skin to provide localized pain relief. And as I've already said, if you are doing anything that involves the skin, whether it's a transdermal patch or a cream, make sure you have on lotion. Otherwise, have on gloves. Otherwise, it's also getting absorbed into your skin. So I'm going to hang around for a few minutes. I am so proud of you all. I am giving you all long distance hugs from Jacksonville, Florida. So thank you all for watching. I appreciate you all so much. And I know that Danita had a question. So Danita, go ahead and put your question in the chat. And if any of you all have video ideas, I don't have a video for my intern to create today. So if you give me a good idea, I will shoot that over to her so she can create the presentation. All right. You're so welcome. It's so great having you here. Oh, I appreciate you all. All right, let's see what question Danita had. Danita, you said you had a question for me. All right, so Danita's question is, where is Ensure kept in a nursing care facility? Usually it's kept in the pantry. And that's if some of your facilities will have like a storage area. So it's in the cabinet, and that's where those supplemental beverages are usually kept. Sometimes they deliver them directly into the patient's room. So the way that it usually goes is these have to be prescribed. Ensure, what's the other one? Boost, they're prescribed. They go directly to a patient. But let's say the patient's on isolation or something, and the dietitian won't deliver that into the room. They leave it outside the room, and you as the CNA, you're supposed to take it in. Well, sometimes they get diverted to the nourishment room, to the pantry. So I'm not sure in context, like was this on a test or something, but it's either going to be sent directly to their room, or they're going to store the excess in a pantry or a nourishment area. So I hope that helps to answer your question. All right. No problem. No problem. I hope that you understand it now. And so, oh, good luck on your exam today. We are praying for you. And Rosalie, no problem. You want to learn more about medications. I got you. All right, everybody. You all have a phenomenal Monday. I'm going to be back on later with some crazy videos I need to post, but I will come back tomorrow with another either CNA or QMA, Qualified Medication Aide video. So I appreciate you all. God bless you. And I'll see you in the next video. Bye, everybody. And thank you for watching, Veronica.
Are you a CNA who's looking to level up your career? Our Qualified Medication Aide course gives you the training you need to start passing meds safely and confidently. If you're in Florida with 1 year of CNA experience, you can attend our Qualified Medication Aide course. It includes 26 hours of online training, followed by 14 hours of in person, hands on training with Nurse Eunice. Take the next step in your career. Enroll today at www.fltraining.com.
All right, so the basic medication administration training course, of course, this is Eunice Mathis with Florida Training Academy. I welcome you here. We're going to review some of the common medications, so we'll do a quick overview. We have cardiovascular medications that can be used to treat heart and blood vessel conditions. In addition to that, we have skin medications that can treat various skin conditions and symptoms. We have respiratory system medications. They can treat symptoms in the nose, the sinuses, and lungs. And there are other medications that we will discuss that treat other symptoms, such as medications for the urinary system, gastrointestinal, endocrine, and also the nervous systems. So with your cardiovascular medications, there are medications that are called vasodilators. So when you think of a vasodilator, that would be a medication that's used to treat chest pain or angina. And then there are also medications that treat high blood pressure. This is important because when you're giving someone a heart pill, you need to know what type of pill you are giving them. Are you giving them something that's going to be lowering your blood pressure or lowering their blood pressure? And if the answer is yes, well, that means that can cause dizziness. So as a medication aide, as a medication administration provider, even though you're not a nurse, you are still responsible for safely passing medications and knowing what medications you are passing. Another type of cardiovascular medication is a diuretic. A diuretic removes salt in water, so it's going to make them diurese. It's going to make them urinate more. And so a diuretic can be used to treat high blood pressure and also heart failure. If the heart is failing, it can't pump those excess fluids. So the way we're going to get that excess fluid out of their body is by allowing the patient to remove it, to void, to go to the bathroom more frequently. Antihypertensives are just that. They are medications which lower the blood pressure. And then we have antiarrhythmics. So let's say a patient has atrial fibrillation, which is an irregular heartbeat. You'll know whenever you feel their pulse, it's going to be irregular. Well, that irregular heartbeat can cause blood to clot, and it puts the patient at an increased risk of strokes. So antiarrhythmics try to put the heart back into a normal rhythm, or at least slow down the rate of the heart so that the patient will have less cardiac symptoms. Our respiratory system medications include antitussives, those are cough suppressants, expectorants. Those are medications that break up thick mucus in the lungs and bronchi. It allows it to thin the mucus so the patient can cough it up. So sometimes your patient's going to be asking for a cough suppressant while saying, oh, I feel like my chest is full of cold. Well, they don't need a cough suppressant. They need an expectorant. They need to bring that up, not suppress the cough. There are also decongestants and antihistamines. Those reduce swelling in the nose lining. They dry up mucous membranes. And also your bronchodilators. They are used to relax and expand airway passages. And common bronchodilators are your nebulizers and also your metered dose inhalers or your asthma pumps. Medications for the skin. Those include protectives and astringents. So when you think of astringent, a common one would be like witch hazel, but they can cover, cool, dry, or soothe inflamed areas. Our antipyretics, those relieve itching from allergies, skin conditions, and insect bites. We also have anti-inflammatory medications for the skin. They relieve itching and suppress the body's reactions to irritation. And then our anti-infectives, aka our antibiotics or our antifungals. They kill or inhibit growth of microorganisms that cause skin infections. And so another type of medication that you'd be given as a medication aid would be medications for the urinary system. And so when you think of the urinary system, a lot of you all just think about the urinary tract. Well, the urinary system consists of more than a urinary tract. So antibiotics would be used to treat the urinary tract, the kidneys, the bladder, because remember that infection can travel upward. And so it can be a very severe, instead of it being a urinary tract infection, it can actually lead to kidney infections. We also have diuretics. So if someone has a kidney issue or a urinary issue, sometimes they don't produce enough urine. So a diuretic, yes, it can be used for somebody who has heart failure, but it can also be used for those who have kidney issues because it increases the output of water and salt, thus helping them to maintain normal urine production. And then analgesics. Whenever you see that word, that means some type of pain relief. So an analgesic, if someone is having severe UTI pain, the doctor may order a medication that will help relieve the pain from the urinary tract infection. And some of those medications can change the color of urine. So you read in those leaflets, the information about the medication you're giving your patient is so important. Our gastrointestinal system medications, or GI system for short, those could be anticholinergics and antispasmodics. So when you think of an anticholinergic, think of something that dries things up. And an antispasmodic, that means the person's having spasms and we need to give them something to counter those spasms. So those medications treat ulcers and irritable bowel syndrome by reducing stomach acid production and calming the muscle spasms. Now, this image shows an inflamed GI lining. So anti-inflammatories would treat conditions such as colitis, and it treats it by reducing the inflammation in the intestinal lining. But if you're giving someone an anti-inflammatory and they go back and they eat Takis or something that's going to irritate their stomach lining, well, the medications alone, they're not going to do their job if what you're feeding the patient or what you're allowing the patient to eat and not reminding them of their condition is going to counter the effects. So remember that medication plays a small part. That's why you need to be a CNA in order for you to be a med aid, because there's more that comes into play, such as dietary restrictions. And then we have our gastrointestinal stimulants. They speed up the transit of food, and they help to relieve nausea and promote gastric emptying through improved digestive motility. So think of it as something that will probably help them to have a bowel movement. That would be a gastrointestinal stimulant. Our endocrine system medications. So we do have our oral anti-diabetic medications such as glyburide and metformin. They do control blood sugar levels. Remember, whenever you have a diabetic that you're taking care of, you want to make sure that their food comes at the same time. We don't need much variation, because if you're giving them an oral anti-diabetic medication, some of those medications can work over a 12 to 24-hour period, and we don't want them to go too long without having food. So you will be checking their blood sugars, but in addition to, or having the aide, another CNA, check the blood sugar. But in addition to that, make sure that they have regular meal times and that they actually eat their food. As a medication aide or a medication administration provider, you are not allowed to give injectable medication. So you would not be giving any insulin. However, that doesn't mean that you won't be responsible for caring for that particular patient. You would just have to notify the nurse whenever the insulin is given. So an injectable or anti-diabetic agent, they also lower blood sugar levels, and they come in different types of versions. So there's rapid acting insulin, intermediate acting insulin, and also long acting insulin. Again, that would not be your responsibility, but you would still be responsible for monitoring that patient before and after the nurse administered the insulin. Hormonal drugs. Yes, the endocrine system actually regulates hormones. So if a person has, let's say they have a condition with their thyroid, well, then whenever you're giving them their medication for their thyroid, you would be helping with their endocrine system. So the hormonal drugs, they treat problems with thyroid, pituitary, adrenals, pancreas, ovaries, and testes. So if a person has a problem, maybe they're going through menopause, you may be giving them their hormonal treatment.
You destroyed an enemy cruiser.
Ship is on fire.
Enemy
Problem solved, sir. All stations reporting. The ship is on fire. Detected.
We've sunk an enemy destroyer.
Torpedoes, direct front.
Hello, my name is Adam Ferrari, the Chief Executive Officer of Phoenix Energy. I look forward to you joining us at our next investor webinar, where you can drill deeper into our 9 to 13% annual interest rate bond offerings and see how our company has become an emerging leader in the oil and gas industry. In 2024, Phoenix Energy rose to become the 11th most prolific oil and gas operator in the Williston Basin, one of America's top producing regions. We are now right alongside industry giants like ConocoPhillips and EOG and plan to continue rising in the rankings. Our daily production rates have risen as high as 18,000 barrels of oil per day. We've sold more than 4 million barrels, and we're just getting started. We hope to see you at our brief webinar. In less than 1 hour, you will learn more about our 9 to 13% annual interest rate bond offerings and the U.S. oil and gas sector. These Regulation D 506E bond offerings are open to accredited investors. Our team will guide you through the details of how to get started. Sign up for the webinar and start your journey with Phoenix Energy today.
Nervous system medications. So if a patient has epilepsy, you would be giving them an anticonvulsant. So even though they may not have had a seizure while they were in your care, the reason why they're not having that seizure is because they have a regimen. They take their anticonvulsants, which prevent the convulsions. So they treat seizure disorders and other conditions. We have Parkinson's medications. They treat or reduce the essential tremor and other medications in your patients with, or other symptoms, of your patient who have Parkinson's disease, such as that shuffling gait. So you give them their medication in the mornings, and then by midday, they're walking better, they're able to speak better. But as that medication wears off, they begin their shuffling walk again. And so you will see that transition throughout the day. are psychiatric medications. They could be antidepressants, anti-anxiety medications, antipsychotics, and also mood stabilizing medications. And a lot of those have side effects. So when you're given a medication as a med aid, you're just not a pill pusher. You really have to take this job seriously so that you can understand and notify the nurse if something goes wrong with your patient. So let's talk about the side effects of medications. A side effect is the body's reaction to a medication, which is different from the reaction the healthcare provider intended. So side effects can be mild to moderate. Mild to moderate is bothersome, but can be relieved without other problems. For example, if you take an antibiotic and it literally says to take with food, but you take it without food, well, a side effect is going to be GI distress. You're going to feel nauseated. There are also some serious side effects to medications. They can be called commonly adverse reactions. So let's say that if you take too much Motrin, well, you can hemorrhage, you can bleed. So that would be a serious side effect. So if your patient's taking Motrin and you see that their stool is now dark, or whenever they brush their teeth, their gums are bleeding, that should alert you that, wow, something's going on. There's a side effect. Something's happening with their medications. And then our severe allergic reactions, those can be life-threatening. And whenever we have a life-threatening emergency, we call it anaphylaxis. So let's just go back through our allergic reactions. We have those mild reactions, runny nose, sneezing, itch, or a rash, pretty much localized. They can become nauseated. They can vomit. They can also start having diarrhea. Whenever it's severe anaphylactic shock, that's when the skin can become flushed. They have rashes, itchiness, tingling in the lips and tongue, a racing heart rate, dizziness, swelling of the tongue, lips, and throat, difficulty breathing, and they can actually collapse, okay? And so that's when you'd be doing the, hey, are you okay? And trying to figure out if you're about to start CPR. So as a medication aid provider, you have to be mindful of allergic reactions. Did you check the patient's allergies before you gave them medication? And if not, you would be causing the patient harm. Now, this is something that, even though we said you can't give injectables, there is, usually if you're outside of a hospital, there is an exclusion. The one injectable you can give is that if someone has an EpiPen prescribed, if you're a first aid provider, you can give epinephrine. They teach that in first aid classes. So use an EpiPen if ordered and available, and always call 911 because one EpiPen may not be enough. The patient may need additional doses of epinephrine, and more than likely, whenever those advanced providers come, they're not using an EpiPen. They're starting the IV and they're pushing the epinephrine intravenously. So MAPS or medication aid may use an EpiPen even though it's an injectable because that is an emergency drug. If a client has a severe allergy, the EpiPen should go wherever they go. For some of you all who will be working in assisted living facilities and group homes, maybe you're having an outing that day and you have a client who has a severe allergy. Well, they can't go without their emergency inhalers if they have asthma, and they definitely should not go without their EpiPen because if there's an emergency, you need to be able to act fast. So medication errors are any preventable event that may cause or lead to inappropriate medication use or a patient harm while the medication is in the control of the healthcare professional, patient, or consumer. And that is from the National Coordinating Council for Medication Error Reporting and Prevention. Common kinds of medication errors include wrong medication, wrong dose, and missed interactions. So let's go back to wrong medication. That would be when prescribing or administering incorrect medications to patients. Wrong dose is when you gave the incorrect amount of medication, whether it was too much or too little, both of which could be dangerous. And then missed interactions would be failing to recognize dangerous drug interactions between medications. These errors can cause serious consequences for patients, leading to adverse reactions, worsening of their condition, or even death. Healthcare professionals must be vigilant to prevent these mistakes. All right, so we also have prescribing errors, and prescribing errors could be the wrong dose, the wrong drug, or the wrong route. So that is what happened before you ever even before you have the medication in your hand. The actual prescriber, the doctor, wrote the wrong order. So that's why when you get a new order, you're always supposed to let your nurse know, because that nurse is going to know, well, hey, this patient doesn't have these symptoms, the patient doesn't have this condition. I don't know why this medication is ordered. She would then go back and contact that prescribing physician and make sure they wrote the right medication order for the right patient. Also, using abbreviations can cause medical errors. So that's why even though we teach you about medical abbreviations, they should never appear on your record as far as like your MAR, your medication administration record, because you may misinterpret something. So QD, QID, QOD, every day, 4 times a day, every other day, those can actually become quite confusing. So what we need you to do instead is to write it out without abbreviations so that there will be no misinterpretation. Illegible handwriting. So in the doctors, that's why a lot of charting right now is electronic, because it's kind of hard to read the doctor's handwriting. 0.25 could be, 25 milligrams if we don't see the point. So it's very important that if you don't understand something, you say something. You notify the nurse or you notify that prescribing physician. And then, as we mentioned earlier, don't forget about those missed allergies. And so you're always mindful. My patient has an allergy to strawberries. My patient has an allergy to penicillin. So if you see an order come across where a patient who has an allergy listed, the doctor missed the allergy. They can sometimes order medications that patients are allergic to. So it's going to be up to you to go back and just review that, because your prescribers make errors also, and you have to catch those as a medication aide. Dispensing errors. So yes, the pharmacy can also make a mistake too. So being a med aide is kind of like being a mini nurse. You have a lot of responsibilities, which is why they also pay you more. But did you know that you'd be responsible if the prescribing doctor wrote the wrong order? If the pharmacist dispensed the wrong medication and you didn't catch it and something happened to that patient, you and that nurse would still be ultimately responsible. So the pharmacy dispensing medications, it is estimated that 14% of medications are dispensed incorrectly. So if a patient's questioning, why does a pill look differently than it looked last week? You need to take heed and you need to be asking those questions. Contact the pharmacy. On the leaflets, the medication leaflets, they will actually have what the medication is supposed to look like and the color. But communication is key. When in doubt, don't be afraid to notify that nurse, who will then pick up the phone and notify the pharmacy if you don't feel comfortable doing so, or if your facility's policy does not allow you to do so. Administration errors. I need for you as a medication aide to stay alert. You must remain vigilant and focused when handling medications. Catch the errors. You are responsible for catching errors made by others in the medication process, and then prevent mistakes. The final opportunity to prevent errors rests in your hands during administration. All right, and so why are we taking medication administration so seriously? Why can't you just pass a pill? I heard a CNA tell me once, well, they get paid $25 an hour to be a med aide, and all I'm doing is passing out blood pressure medication. And it took me aback. I was like, oh my God, you're doing way more than passing out blood pressure medications. You are passing out medications to people who have chronic illnesses who you need to monitor as you're giving the blood pressure medicines to them. So just don't think that you're a pill pusher. You are a first line healthcare professional. You're giving these medications, and what you do or what you don't do can actually cause your patients to become more sick, or you can cause death. So what is the range of harm? Medication errors can start with mild interactions like rashes, but can escalate to severe life-threatening conditions such as anaphylaxis. Single incident impact. A single medication error can have serious consequences. It only takes one incident to cause significant harm. Consequences of medication errors. A major consequence is that the treatment is not effective and the condition of the medication is meant to treat does not get better, or it gets worse. For example, Jacob has been taking Depakote 500 milligrams, 2 tablets by mouth twice a day for seizures. Recently, his dose was increased to 3 tablets twice per day. An error in the MAR reduced his dose to half, leading to a serious seizure and a prolonged hospitalization. He ended up aspirating, you all. So when he seized, he vomited. Some of the vomitus went into his lungs. He ended up being intubated and in the hospital for 3 months, including a rehabilitation period, all because of a medication error. He did not have to have that seizure. So you need to make sure whenever you are transcribing a new order to the actual MAR, the medication administration record, if you're not sure, if you're uncomfortable, let a nurse know. The best caregiver is one who is not afraid to ask questions so that they can help prevent errors or medication errors with their patients.
Wix gives you the power of AI to build the website you need with full business functionality and a design tailored just for you. Customize every element of your website and watch your vision come to life in minutes. Control everything from the biggest tasks to the finest details. Personalized, optimized, ready to go live.
Get ready to rise with more shine. Discover the Sealy Posturepedic collection at Ashley, featuring precision fit coils arranged right where you need them for targeted support night after night. Sealy at Ashley. Wake up to what's next.
So common causes of medication errors, you're doing stuff in the dark. Why? Increase your lighting. So number 1 is poor lighting. Preparing or giving medication in inadequate lighting is unsafe. Number 2, distractions. You TikTok generationers, talking, using phones, watching TV while preparing medications is a no-no. You have to limit your distractions. Don't try to have a full conversation with the patient and his or her family while you are giving the pills. Let them know, well, just for a few moments, I just want to focus on the medications and what I'm giving you, and then we can have that conversation in a few moments. Multitasking. Preparing medications for multiple patients at once is a no-go. It is one patient at a time. You will not have 5 cups and put like room numbers on the cups, because if the cups fall over, all the medications are mixed together. So you do not multitask and prepare multiple medications. You prepare medications for one person, take it to that person, document their acceptance, their refusal, the interactions, and then once your documentation is complete, then you go to the next patient. You will have to become familiar with your patient's medications. And I know starting off, this is going to be a little bit hard, but if you just study a little bit more, you're going to make your life easier. So unfamiliarity or not knowing the clients well is also a cause of medication errors. And the 5th one I would add would be not listening to your patients. If you don't listen to your patients and you think you know it all, you're going to miss out on important information. She may tell you that, hey, my doctor changed this medication. And you're like, no, he didn't. Take a moment, breathe. Your patient may actually be right. And look at the chart, because maybe the doctor told her something that he hadn't yet entered into the system, or that you hadn't yet checked because you were so busy with your other patients. So make sure that you actually listen to your patients to help prevent these medication errors. Focus during medication administration. Look at this busy med aide. So no phone, no TV. Don't try to be multitasking. If you're in an ALF or something, or you're in a patient's home, you're not trying to do their laundry, you're not trying to fix their meals. And then again, no Wi-Fi. So focus on the medications when you are passing your meds. And this is hard to see. I do apologize, but it goes through the 7. And I know yesterday we watched a video, I think it's at the 6. I told you there are multiple, but the rights of medication. So here we have the right client, the right reason, the right medication, the right dose, the right time, the right route, and the right documentation. So I'm going to repeat that. It's the right client, the right reason, the right medication, the right dose at the right time via the right route, and then make sure that you actually put the right documentation afterwards. And you can always refer back to the slide and take a photo of it later. All right, so here we have some other information. So if you're given a medication for the incorrect purpose, such as maybe we have an order for Tylenol, but the Tylenol is ordered for pain, and you notice that the patient has a fever and you give the Tylenol for fever. Well, that's not acceptable. That is the incorrect purpose. You would literally have to call a provider back, let him know this patient has a fever. I think that would be extremely important, and then get more orders. Maybe we're going to get an order for a urine specimen, a sputum specimen, and then maybe orders for antibiotics. And now you get a supplemental order for which you can now give the Tylenol, not just for pain, but you can also give it for a temperature greater than 101. So it has to be very specific. If you give a medication without prescription, even if it's an over-the-counter, that's also a medication error, because giving a medication for which there is no current prescription is against protocol. And then an unordered dose. So if you decide just to give them an extra dose of medication because you just have it there, that's also a medication error. So be very careful. Take your job seriously. So medication error, wrong dose. Are you giving the incorrect amount? Are you giving more orders than were ordered? The main cause of this is not immediately documenting on the MAR when you give medication. So make sure you document in real time. All right, so medication error, wrong person. Giving medication to one client that is prescribed or ordered for given medication prescribed for one client, but you're giving it to the wrong person, that is a medication error. So common causes, again, distraction, client awareness. Be alert for clients trying to grab medications belonging to others. Some people are actually, you're going to have two types of patients. The patient who wants no medications and the patients who want all the medications, and usually it's the good stuff, it's the pain medicine. So you have to be aware of your clients. And, I hate to use the term drug seeking because we don't want to talk about our patients in that manner, but there are some patients you need to be more aware of because they are trying to see if they're going to catch you slipping. And if they can get 2 Ativans out of you or 2, morphines out of you because you're not documenting, you're not paying attention, you're going to cause medication errors. All right. And so what if you don't check the identification? You have to know your client. If you are unfamiliar with your clients, a lot of your facilities are going to have a picture on the MAR that, again, is the medication administration record. And for those who did not watch our first video, medication administration providers and or med aides, they usually do not work in hospitals. They work in long-term care facilities. They work in group homes. They may work in assisted living facilities. They work in places that don't have enough nurses. So they are assisting the nurse who's out doing the wound care, et cetera, and the more advanced treatments. They're assisting the nurse by giving out medications, but they are limited in the medications that they can give. And so if you don't know the client, you're going to look at the medication administration record. It's going to have a picture of the patient. And then when you get through looking at that picture, I need for you to check your patient identifiers. You never go to a patient and say, hey, is your name Lucille? Because she's going to say yes, because she may be confused. So your patient identifiers can include the client's name and date of birth. Those are the 2 main identifiers. And then if they have an armband, you can also look at the medication record number. Additionally, verify information verbally with the client to ensure accuracy and prevent wrong person errors. All right, so the wrong route. Oh my, could you imagine 40 years from now, you need care, and that young, wonderful, very ambitious medication aide put an eardrop in your eye? Yeah, I couldn't imagine that either. So remember that ear medications and eye medications, they come in those little teeny tiny bottles and the labels are small. I need for you to read those labels to make sure you're putting the right medication in the right area where it's supposed to be administered. So a common medication error is when you put eardrops in someone's eye. So John is ordered antibiotic ear drops, and you put the medication in his eye. And so now he's saying his eye is burning, is irritated. What do? Oral to gastric tube. So Letha's medications are ordered to be given orally, crushed in pudding. You dissolve the medication mixture in water and give them through her gastric tube. For a lot of medication aid providers or med aids, you're not allowed to give enteral medications through a gastric tube, not without more training. And so every state varies. If you don't understand the rules, you're going to contact the Board of Nursing, find a med aid program in your area. But again, usually you have to be a CNA for 1 year before you can apply to become a medication aide. If you give the medicine at the wrong time, you are also committing a medication error. So you have to make sure that the times match. Match the time on the MAR with the time on the medication label. Usually your MAR, especially if it's printed by a pharmacy, it will have those times. So if a medication is due twice a day, it's going to say 9 a.m. or 0900 and then 9 p.m. or 2100. So if you don't know military time, you're going to have to learn it in the medical field. AM, PM, be very careful. If your medications are labeled in the AM, you give them in the morning. If it's labeled in the PM, you give them in the evening. And then your time window. Your medications have a time window. A medication may be given 1 hour before the time on the MAR, up to 1 hour after that time, and yet still be on time. Sometimes your antibiotics, especially if we're going to be drawing peaks and troughs, which are levels to make sure the medication is therapeutic, that may be a little bit different, where you don't want to be an hour late, because if lab is coming an hour afterwards to draw the peak, well, then you have messed up that lab. So you want to be very careful. Medication error. If a medication is not given, you still have to document it. So if a medication is not given due to client refusal, that isn't necessarily medication error, but it must still be documented, and you must notify the provider. MAP failure. That means you were lazy that day. You got distracted. You forgot to give this person their medication. Well, we're going to write you up. You got to let us know, because that patient needed his blood pressure medication. If the medication is unavailable, why is it unavailable? Did you let anybody know that you ran out of medications? You should not be running out of these patients' medications, even if you're in an assisted living facility, because a lot of your pharmacists, the pharmacies deliver the medications to you. If they're like with VA, sometimes they deliver the medications once every 3 months, so they will send you a 90-day supply. You do not wait until day 80 to request more medications. You want to have those medications coming in advance. So you would work with your nurse to make sure that you don't have to document medication unavailable because you ran out of medication because you never contacted the pharmacy to refill the prescription. That goes with delayed prescription filling. If a doctor writes an order, you only have so many hours to get that medication. What if the pharmacy doesn't have that medication? You need to notify the doctor, because if you don't, you are actually creating a medication error. Insurance issues. When these insurance companies change, they don't always cover medications. Well, that means we have to notify the provider to get a medication that the insurance actually covers, at least until the interim. And then, of course, pharmacy issues. They may run out of opioids, narcotics. They can run out of antibiotics. So if you're having an issue with the pharmacy, let your provider know also. And so those are some additional medication errors, which would look bad if you don't follow up. So make sure that you are aware of all of those too. Our storage requirements. Medications need to be secure. Your patient should not have access to your medications, even if you're in a small assisted living facility. So all medications must be kept centrally stored in a locked cabinet, a locked cart, or a locked storage area at all times. If it's a controlled substance, let's say it's morphine, it has to be double locked. You're going to keep your medication in its original packaging. The medications must be kept in their original or legibly dispensed labeled packages. So you just can't go out and pour the Tylenol into a separate container. The Tylenol needs to stay in the Tylenol container. And then immediate return. Each client's medication must be returned to the storage unit immediately after use. So if you pull out Tylenol to administer it to the patient, whenever you're done with it, you take the Tylenol back and store it again. This is a lot of information, but you want to be a medication aide. You want to take that next step to see if nursing's for you. So with medication disposal, medications that are expired or discontinued must be disposed, and we just can't throw them in the trash. The disposal documented on the medication destruction record. So there's actually going to be a ledger when you're writing out your medications, when you're doing your count, you're going to let us know that you threw away however many pills, but it has to be witnessed. Okay. So destruction is witnessed by another map, or in most instances, it's going to be witnessed with a nurse, whether it's as your LPN or your RN. And so the best practice is to, if you don't want to be throwing these medications in the toilet, is you're going to see if the pharmacy has a take back program, so that they can destroy of it properly so that it does not pollute our water system. An alternate method is to mix the medications with coffee grounds or kitty litter and water and then dispose of them in the trash. Remember, if you just throw a whole bunch of pills away in the trash, we have people who actually go through the trash cans looking for pills. And so we don't want them to get access to these drugs. So you want to work with your nurse in your facility to figure out the best way to dispose of those medications.
Are you a CNA who's looking to level up your career? Our qualified medication aid course gives you the training you need to start passing meds safely and confidently. If you're in Florida with 1 year of CNA experience, you can attend our qualified medication aid course. It includes 26 hours of online training, followed by 14 hours of in-person hands-on training with Nurse Eunice. Take the next step in your career. Enroll today at www.fmedcare.com.